initiatives have. We really believe that Rob's legacy is so incredibly noteworthy and one that I feel proud to continue to work on with all of you. Reiner and his wife Michelle were activists that were deeply committed to other causes as well. And I want to mention another initiative that they worked on, Proposition 8, and they founded another organization called the American Foundation for Equal Rights, which initiated a court challenge against Proposition 8 to have it repealed. And I was very fortunate with my wife to be plaintiffs in that case while I was executive director at First Five California. So you can imagine the impact Rob Reiner has had on my life, on the life of my wife, on the lives of our children, but more importantly, the trajectory of the lives of millions of children in California and around the world. And it's a real honor to be able to pay this short tribute to him and to share that history with all of you.
Thank you so much, Commissioner. I want to note that we are now joined by Dr. Sood. I'd like to welcome our new Health and Human Services ex officio designee, Dr. Soheil Sood, Director of the Children and Youth Behavioral Health Initiative at the California Health and Human Services Agency. Dr. Sood is also a practicing pediatrician and faculty member at the University of California, San Francisco, where he provides care to newborns and hospitalized children. I hope you'll all join me in welcoming Dr. Sood to the California Children and Families Commission. And I don't want to put you on the spot since you literally have been in the room for 30 seconds, but I'm going to. So if you've had a chance to catch your breath, would you like to share a few words?
Good morning, everybody. It's a pleasure to be here. I'm sorry for first impressions and being late to start, but yeah. So maybe I'll start by just honoring the person in whose chair I sit, which is Secretary of Health and Human Services, Kim Johnson. I think part of the reason she's comfortable designating the role is because her heart is always with the youngest Californians. For those who know her, she's both served in and then led the Department of Social Services before now being the top health official in the state. And her heart will remain here. So I'll do my best to represent that work. As you noted from the bio, my entire professional career has been devoted toward young people. I still practice in hospitals and take care of newborns primarily. And so bring those stories and encounters with the work. And in the policy realm, I focus a little bit on mitigating the transmission of COVID and other infectious diseases in childcare settings and in schools. And nowadays, I focus exclusively on mental health substance use issues, which includes the youngest folks in the state. So honored to be here and get to work.
So glad to have you here and really appreciate all of the facets of your work that you bring with you. So we are going to now open this year's meeting, and I'll give you a little preview of what's in store. We focused on building safe, stable, nurturing beginnings, of course, and a new year brings new policy opportunities, and I'm looking forward to continuing to advance our mission and goals in alignment with the strategic plan we adopted last spring. Executive Director Wong will provide more context and an overview of the framework for this meeting during her opening remarks. I also want to note that we'll be removing item 4 from the agenda. And in reviewing your agenda, you'll notice that most action items will be up front, including the adoption of the scopes of work for our state and federal advocacy efforts. Following that, we'll have a data presentation focusing on statewide data to help inform commissioners and the public about the well-being of young children and the current needs of parents and caregivers of young children in California, really working to use that data to inform our practice and the investments we make here. We'll then move to information items related to financial and legislative updates, the adoption of our annual report, which will highlight the ways the network is leveraging First Five's role to create a comprehensive early childhood ecosystem and planning for sustainability. Lastly, we'll receive a presentation on outcomes of the home visiting coordination grant, which you all may remember, and that will highlight the experiences of counties and recommendations to improve home visiting access across the state. We will share some information about public comments. Regarding public comments, any members of the public will be given the opportunity to make comments on each agenda item prior to any commission action. If public comment is not specifically requested, members of the public should feel free to request an opportunity to comment. The total time allocated for public comment may be limited. Comments will be limited to 3 minutes per person. However, we may decide to shorten or lengthen the public comment period. Members of the public will not be permitted to yield their allotted time to other members of the public to make comments. Before the beginning of each item, we ask members of the public to use the public comment sign-in sheet for those here in Sacramento and in the other satellite locations referenced in the agenda. Or you're joining us from Zoom, we ask that you please use the raise hand function. We'll take public comments in the following order, since we have so many locations. First, here in Sacramento, then to our satellite locations in Washington, D.C., Fresno, and Stanford, and then the virtual queue via Zoom. This will allow us to effectively navigate the public comment process. I'll now ask if anyone has conflicts of interest. Commissioners, please let me know if any of the agenda items present or may potentially present a conflict of interest for you. Obtaining this information in advance will ensure that I can announce your non-participation in any aspect of that item in compliance with applicable laws. Does any commissioner want to state a conflict of interest on that? Anybody remotely? Thank you. Thank you. All right, in accordance with our agenda, it's my pleasure to invite Executive Director Wong to share her report.
Thank you so much. We'll wait for more staff to share the presentation. Yeah. So today, I will start with a couple of notes as we move along. Is that our executive director's report will include executive office updates, some administration division updates, contract and procurements updates, EGA and fiscal and program and innovation and evaluation, kind of general template. So I want to first start for one, thank you, Commissioner Perry, for sharing your experience with the late great Rob Reiner. So we were all deeply saddened by the passing of Rob and Michelle Reiner. We know that Rob Reiner's heart for children and families helped elevate early childhood as a shared public responsibility in California. And his leadership leaves a lasting imprint on the work we carry forward every single day. He believed deeply that when we support children early, we change the course of their lives and strengthen the future of our communities. That conviction lives on in our commitment to safe, stable, nurturing beginnings and stronger systems of care for all families. At a time when many families are living with fear and uncertainty, including those impacted by immigration enforcement, their legacy feels especially urgent. Honoring the work means showing up with compassion, standing alongside our families and our communities, and continuing to build a California where every young child is safe, supported, and able to thrive. So this year's commission meetings are organized around a clear set of themes that reflect First Life California's commitment to helping children get the best possible start in life and thrive. That is our vision. It establishes a 4-meeting thematic arc aligned with a strategic plan, moving from vision setting to systems alignment, infrastructure, sustainability, and future policy direction. Each meeting explicitly connects the Commission's vision, mission, North Star, and core strategies to reinforce a coherent systems-level approach. Themes are designed to support deeper Commission dialogue on cross-agency alignment, county-state coordination, and long-term sustainability. It integrates a 2026 landscape lens, highlighting key California-specific and national risks and opportunities, quite frankly, impacting the early childhood ecosystem. It creates consistent structure and materials to strengthen shared understanding and strategic continuity across all Commission meetings. So as we begin this year, we return to our core, the vision that every child in California receives the best possible start and thrives. This meeting grounds us in the foundational conditions that make that vision real. Safe, stable, nurturing relationships environments for California's children and families, as highlighted in our strategic plan. Our North Star reminds us that trauma-informed, healing-centered, and culturally responsive systems are essential and necessary for children's healthy development. Today, we examine how those systems start at birth. In reviewing our vision for the future is that California's children receive the best possible start in life. We believe that early childhood is foundational to lifelong health, learning, and opportunity, and that this commission plays a critical role in advancing that start, especially for children facing the greatest inequities. Our mission reflects how we do that work. We convene, partner, support, and help lead efforts to create a more coordinated prenatal to 5 system. The themes for this year's meetings are intentionally designed to strengthen coordination across agencies and counties, so families experience systems that work better together for them. Our North Star reminds us how systems must operate to achieve our vision: trauma-informed, healing-centered, and culturally responsive. Systems are, again, necessary for the SSNREs, as we call it, shorthand, for children's healthy development. Finally, our audacious goal challenges us to think long-term, that in a generation, all children prenatal to 5 will have the relationships and environments that are necessary to thrive. Achieving that goal requires sustained alignment, long-term investment, and systems that are resilient over time. This is what today's meeting is about. I want us to ground us in our roles. We know that First 5 brings people together around what matters most: children and families. Through convening, advocating, sharing knowledge, and catalyzing learning, we connect partners across California to strengthen how systems support young children. When families, counties, leaders, and communities move in the same direction, we create real possibility, helping to ensure every child grows up safe, stable, and nurtured. But there is growing instability in federal investments for families. Childcare subsidies, food supports, tax credits will place more pressure on our state systems. So, California, but we have childhood poverty is rising nationally, and California must lead where others may not be able to. California's momentum on early childhood issues such as mental health, developmental screening, and public awareness campaigns has positioned us to accelerate progress. This commission is uniquely poised to unify partners around a data-driven start. Lastly is a highlight of our strategic plan. This slide essentially brings us back to the heart of our vision, North Star, and strategies form a single connected framework, guiding how we show up for children and families across California. The themes for this year help translate that framework into action, strengthening foundations, improving systems, supporting communities, and keeping our focus on long-term impact. Together, this approach allows us to move forward with clarity and shared purpose, ensuring more children grow up with safe, stable, nurturing relationships and environments that they need to thrive. So I'm going to go forward to the administration division has been busy with a lot of kind of implementation of processes and procedures, but we're excited to actually introduce 2 new members of our team. Is Yane Olson Morgan, who joins us as the Deputy Director for our Program Innovation and Evaluation Division, backfilling Dr. Martha Dominguez Brinkley. So I invite you, Deputy Director, to share some words.
Yeah, no, I have had the tremendous sort of joy.
And can I ask, I don't know if everybody who's joining us remotely can see you.
Yeah,
Yes, that's great, thank you.
Yeah, no problem. But once I'm here, I'm No, I will say I will keep it short. But in short, I've worked with agency and Dr. Nini Burke-Harris through the Office of the Surgeon General and had a chance to really appreciate and engage in the work of First 5 Commission and the really vital work of supporting children and families over the years. So it's such a pleasure, particularly given the federal instability that we're experiencing right now, to be able to come back to state service and do so by rejoining this collective effort at First 5. So I'm just very pleased and excited to be with you all.
Thank you. We're so glad to have you.
Thank you. Next up, we'd also have Daniel Schaap, who joins us as the Director of Contracts and Procurement, backfilling Earl Cardenas, who took a promotion elsewhere. So Daniel, welcome. Our new contracts person.
Thank you. Daniel Schott. I've been here for about 8 days, so learning a lot. Doing all the onboarding and process and all that. So I came from the Department of Social Services, where I was a section chief over their non-IT contracts office. Prior to that, I was the Department of Fish and Wildlife. So I've been with the state for about 11 years. Very excited to be here. I think the mission of First Five is incredible. I have an 8-year-old son, so it means a lot to me what we do here. Just happy to be here and meet everybody. Thank you.
Thank you.
Vernetta Syphex, who many of you already know, has returned she's returned out of retirement just briefly and giving us a little time to actually address some of the challenges that have been going on with the Kid for New Parents, because that was her portfolio while she was here. So we are very excited to have her back. She still gets to enjoy retirement, but she also we welcome her back in terms of addressing those systems improvements for the kid. And so we're going to go in depth about the kind of the budget and budget narratives a little bit later. But as we look ahead in 2026, I want to share that First Five California is advancing a focused legislative agenda grounded in equity, prevention, and systems change to support children prenatal to 5. We've begun early engagement with legislators and key caucuses to build relationships and elevate priorities while continuing to center community voice through close coordination with counties and partners. At the same time, we're strengthening our internal capacity and planning major 2026 initiatives, including, as many of you know, the Children's First RFP and Their Futures First Summit in the fall, as opportunities align to the field and advance our shared vision. In regards to the communication updates, our communications work continues to elevate early childhood statewide. New creative content begins airing in March. The Stronger Starts Roadshow now has reached 40% of counties. I know that was a priority of the commissions. And planning is underway for our second statewide day of action with a lot of interest from county engagement, helping to build shared understanding and public momentum for young children across California. The program and innovation evaluation update highlights how our team continues to strengthen the data, evidence, and learning that informs First Five California systems and policy decisions. We have entered a new 3-year partnership with UCLA's Center for Health Policy Research to support California's Health Interview Survey, also known as CHIS, through 2028. This investment ensures continued collection and public access to critical child health and social data, including through Ask CHIS and the Neighborhood Edition. CHIS data is widely used by county commissions, state agencies, and advocates to inform planning and policymaking. For First Five, it is a core tool for tracking our key field indicators and measuring progress on the 2025 to 2028 strategic plan, supporting equity, systems, strengthening, and better outcomes for children and families. Impact Legacy continues to advance our strategic plan by strengthening equitable, high-quality workforce pathways across all 58 counties. In its final year, the focus is on sustaining systems that improve educator preparation and professional learning, driving better, more consistent outcomes for young children statewide. The MMLL Multilingual Learner Specialist role helps align state and local systems by connecting early identification, professional learning, and cross-agency collaboration. This work strengthens our statewide infrastructure to more consistently support our multilingual, oh my gosh, that's a tongue twister, as an English language learner, multilingual language learner and their families, building on our 7-year investment in the dual language learner investment twist. Yes.
Lovingly called MLL.
MLL. For 7 years, now we are ML. So, oh my goodness. And of course, have the multilingual learner say that in a mouthful. It's like a Jeopardy game. So, moving on, we are so deeply appreciative of the leadership and partnership from small population counties and the association in implementing SPCFA. This work directly advances Strategy 4 by strengthening county capacity, reinforcing network resilience, and deepening state-local collaboration. So as we move forward, we'll continue working together to identify strategies that support long-term fiscal sustainability as requested by the Commission for the First Five Network and families we serve. Lastly, we recognize that the shipping delays in the kit for new parent created challenges for our county partners across the state, and we appreciate their continued collaboration and their patience as we were addressing the issues. Those issues are now resolved, we think, right, Anthony? And improvements underway reflect our strategic plan focus on strengthening family access, system reliability, and coordinated support. In parallel, our fatherhood initiative work continues to advance inclusive family-centered systems with a potential opportunity for First Five Californians to play a convening role statewide. And I believe next commission meeting, there will be a solid proposal about what that will look like. And that is it for me. Thank you so much.
Thank you. I wonder if, I don't know if any commissioners have any questions. I've got a couple quick ones. First is just gratitude. Really thank you for recentering all of us on our strategic priorities, and it's really sacred work. And also for your work to build a strong administrative leadership team. Really appreciate that. And I'm wondering, just for clarity and transparency in terms of the kit for new parents, really, how far behind are we? What is the status? I just want to make sure everybody's aware. I know this isn't a comfortable conversation, but I think the transparency is important.
I think that's important, and I'll ask counsel to help me because he's been involved with loosening up some of the challenges with shipping. Right now, we have resolved some contracting issues with our distribution partner. And we have shipped through all the requests to be transparent April of 2025. And so they're starting to ship May of 2026. There were just kind of, how shall we phrase them?
I mean, I think what we have now, I think, is a stronger line of communication so that if there are hiccups, like I'm able to reach out to them directly to recharge anything that's a stoppage. I think before that was maybe a little bit clunkier. So I think that if there are interruptions, there shouldn't be, but if there are, they get remedied a lot faster. So I think it's much better process right now that we have, which is good.
But acknowledging that we are in January 2026 and they are starting to ship the request from May 2025. So
I guess just for clarity, so from May through now, we haven't shipped any kits.
So we have been shipping. Well, there was a delay even before that. So we're delayed shipping. So the requests we're processing, we processed all up through April. And so the requests submitted in May of 20 are now being processed. We have enough kits. And so there were shipping challenges because of contract challenges and agreements. Those agreements have been resolved. We involved counsel on both sides, both the shipping agency and us. Those have been resolved. We have had administrative support around addressing those concerns with our shipping partner. And so that's where now they are shipping.
Great. And will you keep us in the loop about whether we've gotten them all?
We will.
Thank you.
We will. And that is why we knew we called for reinforcements and have Renata coming out of retirement.
Terrific. Thank you.
Can I ask a follow-up question? So what does that mean in terms of the local level? It sounds like our birthing parents haven't been receiving kids. And has the content changed? I mean, is the information that's included in the kits from last year still relevant? And is the plan then to get them all caught up? And so what are locals going to do with huge volumes of, I'm just trying to understand the logistics at the local level.
The content hasn't changed to my knowledge. We are shipping what we have on hand and we have enough to cover, my understanding is cover all of the requests that have been received from May to now. So that is it's been printed. They just have to put them together and send them.
So hundreds of thousands will be received at the local level at one time.
Is that the volume?
It's hundreds of thousands, but not at one time. It's, again, our shipping partner, which is, the Office of State Publishing.
And I'm wondering, would it be possible maybe to provide like a one pager or a brief update to commissioners about what the volume is, where they're going, how long people have been waiting, just so that we all have those details? Would that satisfy your?
Yeah, and impact. I'm just worried about what that means from a local perspective in terms of managing and handling huge volumes of kids. So, yeah.
And there's a
Take
steady
that
flow,
offline.
so it's not all being sent in 1 month.
Yeah.
So it is steady, it's steady distribution.
Okay.
And we're happy to provide you a memo. I'm looking at Yana, she's taking notes.
Thank you.
As she's taking notes on what that update in the process.
Thank you very much. And will we get more information about the statewide day of action at the April meeting?
We will,
Wonderful.
or sooner than that. We'd love to engage you before.
Excellent.
Yeah, we should.
We'd love to engage commissioners before that.
Terrific. Well, thank you and thank you for the work. And now, in accordance with our agenda, it's my pleasure to invite up Avo Magdessian, First Five Association Executive Director, for his opening remarks. And I guess I will ask, in case you have any insights into the kits and what that looks like for counties. And I think to some of the questions we just received around capacity to absorb all of the kids that are going to be coming. So if you're happy to that would be helpful.
Thank you, Vice Chair. Yeah, I'll start there. Again, good morning, everyone. Thanks for having me on the kits themselves. I know First Five Counties have been communicating directly with First Five California staff about the challenges with ordering. Several First Fives are working with each other to see who has inventory and doesn't, and have been sharing resources that way as a sort of stopgap. But I do appreciate Director Wong's commitment to ensure that counties aren't overwhelmed with pallets and kids, because we know storage is an issue. It's been an issue since the start of the kits 20-some years ago. And so really appreciate the acknowledgement that we need to regulate or modulate the shipments now that are coming in, but really appreciate the focus also on getting these kits to community. It is literally the most tangible thing that the First Five Network provides to every family. And it's also the longest standing investment of the commission. So it is a huge, huge investment, and it has the most tangible impact. So really appreciate the focus on it.
Thank you.
And also, just for transparency here, hospitals have also been contacting us outside of the First Five counties. So it's not, when we say counties, it is actually the health infrastructure too, all the partners.
All the partners.
Yeah. And we've been in communication with those First Five county partners.
Dr. Sue will have to let us know when they arrive at his hospital.
Well, I just have a few updates that I want to share with the commission, and they are sort of 4 areas. Wanted to update the commission on our work with our Medi-Cal learning community, some specific areas around policy that the association will be focusing on for 2026, a continued update on the Choose Children gubernatorial education campaign, and then one county highlight that I wanted to share with the commission. Get used to this. All right. On the Medi-Cal learning community, this is a learning community that the association kicked off with financial support from the home visiting coordination grants that First Five California invested in. Later today, you're going to hear a lot more specifics from First Five county commissions and their successes, as well as learnings from that effort. The Medi-Cal learning community was sort of a parallel effort where we were focused on readying First Fives to be Medi-Cal service providers in their local community. And importantly, what that means is a lot of internal change management and focus on what it takes to be a Medi-Cal provider and partnering with the managed care plans. In essence, the effort has been to draw down as much state dollars to local communities as possible, especially communities that don't have some of those Medi-Cal billing hubs. And so we thought First Five County Commissions could be perfect partners there. So in terms of a few milestones that I want to share, we now have 8 First Five County Commissions that are contracted providers with managed care plans. Another 26 are actively working towards contracts with managed care plans right now. There's been several millions of dollars from the state that has been provided to First Five counties to provide capacity building and some of that internal change management. And one thing that we are looking forward to is seeing how this model that we've implemented for a couple of years could be expanded to unlock other state resources for local communities. We're looking at, of course, the CYBHI fee schedule. Hello, Dr. Sood. We'll talk to you about that, as well as FFPSA, which you'll hear about more later on today. In terms of policy areas for 2026, we are focused mainly on 2 areas. The first is the Behavioral Health Services Act, and the second area is around home visiting. In terms of the legislative and budget focus areas this year, we are really focusing on First Fives being eligible partners when it comes to BHSA implementation, particularly with prevention dollars that will be released in July, given our unique perspective on early childhood behavioral health. We're also going to be looking for increased funding in early childhood mental health, because there's been mixed reports at the local level on BHSA implementation, and we are concerned that early childhood mental health may be cut in some local communities. Again, it's been mixed, but we're looking for the state to shore up and hopefully prevent some of those cuts through implementation. And then last but not least, we are going to continue our administrative advocacy around better coordination around home visiting and utilizing local home visiting infrastructure when it comes to deploying that into communities. We were really proud to be asked to partner with the HCS, CDSS, and CDPH to craft joint guidance for managed care plans to utilize the local home visiting infrastructure and make sure that referrals to home visiting providers aren't just done in a blanket way, but we're actually looking at capacity of local providers and ability to deploy before we refer families to programs that may not even exist in the community. So really some technical areas of policy that we're focusing on this year. Okay, I'm gonna get. And then I also wanted to provide a commission highlight. Again, we'll hear a few highlights later today around home visiting from several county commissions, but I wanted to uplift a recent announcement from the local First Five Sacramento County Commission. They recently granted over $4.1 million to 35 local organizations. While that on its face is not remarkable for putting out dollars all the time, the way they did it and the approach is something that I want to uplift for the commission. The First Five Sacramento provided these grants to grantees in the community using a participatory grant making process. But they went a step further than just getting advice from community members on where the dollar should go. They literally said, you make the decisions to where these dollars should go. And so they had a panel of community providers, parents as well, that made those decisions directly. If you all know how participatory grant making works, it's a lot of infrastructure work and intentional training with parents and community providers on how to make those public funding decisions. It doesn't happen often, if at all, in the public sector. And so I just want to uplift First Five Sacramento's bold vision to shift power to community, to say, here's $4.2 million. You tell us how to spend it, and we will do it. And so as a result, you have 35 organizations who have never been funded by First Five Sacramento. They're new grantees. They're new grantees. And so again, I just want to uplift this as not just a state model, but a national model on how public agencies can shift power to community. It's not that hard. It'll take some intentionality, but it's not that hard. And it takes trust in the community, knowing that community members closest to challenges are the ones that have the solutions.
Thank you. And I think it's incredible and it'll be exciting to watch this work and follow the implementation. I do see that Chair Albright has her hand up. Chair Albright, I don't know if you were trying to jump in right now or if you'd like to wait until the end of the update.
I would love to ask Director McDazian one question about the gosh, wait, hang on, it's on my screen. Apologies. About the Medi-Cal. You talked about providers, and I'm curious who those providers are that the County First Fives are working with. Is it family resource centers, which is what I'm familiar with in San Francisco, or is it including childcare and other providers and communities?
Yeah, it depends on the specific Medi-Cal drawdown. So community health workers that work for nonprofits, some of them are attached to family resource centers. That's an example of it. Health clinics are another example. So it all depends on which Medi-Cal funding we're talking about.
Okay, I'll follow up with more questions. Let's say it's a health clinic. Do those health clinics have contracts with First Fives?
Correct.
Got it. Okay, interesting.
If they're not direct providers with the managed care plans, they contract directly with First Fives.
Interesting. It's an example of how the ecosystem really is being created because you're blending and braiding funding between childcare, family resource centers, and health clinics. So it's a fantastic example. Thanks so much. I appreciate it.
Really is the superpower of California. We have this built-in local infrastructure throughout every county that's focused on early childhood implementation. And so Medi-Cal has been a great way to plug in to that infrastructure. I just have a couple of quick updates on Choose Children, and then I'll sit down. This is, as a reminder for the commission, a statewide campaign focused on educating the candidates running for governor. Just this morning, we have another candidate who declared, the mayor of San Jose, Matt Mahan. So the list continues to grow and not shrink. We have about 10 viable candidates right now, which is a lot, but we're engaging all of them. I wanted to just uplift a few updates and some dates for the commission. We had our official launch in December. We have a partner toolkit that's coming out next week where anyone who wants to engage in engaging the candidates will have a toolkit to do so. We have our detailed policy agenda, which I know this commission has been very interested to see coming out the week after. And we have a few candidate conversations that have been set up. One in the Bay Area, a couple in Los Angeles, and one in San Diego. And then we're still planning a statewide debate in May. So that more information to come. That QR code on the screen gives you all the data that we used in the launch, as well as these dates. And then my last slide here is we ran some polling results. We ran a poll, Choose Children ran a poll in November of last year. And this poll was meant to illustrate to candidates running for governor that early childhood and the joys and challenges that parents are facing in California are real. And not only are they real, they're supported by voters. And so our poll showed overwhelming support that the next governor should prioritize young children and families. All the policy areas that we tested also had overwhelming support. Nearly 9 in 10 California voters support the policies that we all care about. And no surprise that affordability and cost of living is the #1 issue on voters' minds. Just to illustrate that, here's a slide with voters with children under the age of 12. When asked about the financial strain that California is placing on them, to raise children. You can see that 74% say there's great or some financial strain living in the state. What's interesting with this slide is that only 9% of voting families say that they have no financial strain. Think about that, less than 1 in 10 California parents who vote. This is a big slide we lead off with all the candidates. We have 83% of voters who say that the next governor should prioritize young children and families. When you ask parents the same question, it jumps to 91%. I won't go through this detailed slide, but you can see that affordable childcare, fair wages, mental health workforce, and mental health supports all have overwhelming 8 in 10 or 9 in 10 support from voters as policies that they want to see more investment in for the next administration. And that is my update. Thank you.
Thank you. And do any commissioners have questions?
So with the survey, how many people were surveyed?
I added it on the list. I want to say, or in the deck, I want to say it was at least 600. Get that for you, Commissioner.
And this, one more question, is
Yeah.
this throughout California or is it a specific area?
Yeah, it was statewide throughout California. And the reason why we tested children under the age of 12 is if we wanted to do children under the age of 5, we would have to vastly increase our universe, and that becomes cost prohibitive. So under 12, and let's see, we had 801 likely November 2028 voters.
Those are likely voters.
Correct. This is what the candidates care about. We're in the mindset of what do candidates care about? That's what we're going to do our research on. And that's how we lead
And
the
then
conversation.
another question, when you said candidate conversations, it's not a forum, it's just individual meetings.
Correct. Yeah, we want each candidate to have full reign of all the promises they're going to make to support children and families without a debate atmosphere. That'll come in May.
And then so in May, definitely engage us or involve us in, in your assembly. And then another question. In the Sacramento First Five effort how many members were on that panel that were making decisions?
Yeah, I believe it was 15 members of the racial equity committee. I don't have the exact name right. But I believe it's 15 members, community providers and parents. A lot of work. It's been a couple of years in the making.
Thank you. Great work.
Having been here in Sacramento, I think that the group was larger. It ended up 15, but they reached out to 60 organizations. And you can imagine it was more than a couple of years because they had to publicly say, we're not going to fund anybody we've ever funded before. So you can imagine what that would, the conversations that needed to be held over the course of, I want to say, 6 years or so to get people comfortable and dedicated to this is how we're going to fund differently. We're not going to fund. And those of us who are in Sacramento actually watched it very closely. I'm very proud of those moments. So can you imagine us saying we're not going to fund the people who traditionally fund it? So that becomes a different type of conversation.
Okay, are there any questions or comments from our commissioners that are remote? I have one question, and it's just I'm not quite sure the type of entity that Choose Children is. Are you going to and are you able to endorse the candidate who best meets Choose Children's priorities?
No.
How will you rank? I guess my question is, based on the candidate conversations, the debate, how will you share who is best for kids with all of the voters who've said this is one of our top priorities?
Yeah, our approach with Choose Children is because we want to educate all the candidates because we know one of them is going to win. We hope so.
There could be a new one that you have not yet
That's right.
seen.
That's right.
Tomorrow. Yes.
Yeah.
Our approach is strictly engage and educate, rather than endorse and support, partly because a lot of the IRS rules around electioneering and where the investment for Choose Children comes from is largely.
Yeah, that's why I asked.
But we're hoping that through the engagement and education and the forums and the data, there might be other organizations that can endorse.
Yes.
And see the information and rhetoric coming out of the candidates and can move accordingly.
Excellent. Thank you. I have one more question. Oh, two more questions.
And so is Choose Children, is that a 501c4?
It is not. It is a coalition of partners that are all 501c3s. And all the funding is also 501c3 expended.
Okay, so 501h, in terms of how it's spent. And then,
Yeah, we're not lobbying at all.
you're not issuing report cards or anything?
No report cards, no lobbying, no picking our favorites.
Okay, so strictly
That's right.
And that is why we were comfortable writing the policy primer that is actually on the Choose. So that's why in First Five California, we hosted and we actually did that work because we were comfortable with that level of education for all of our teams.
It's a great example of how we've been able to get more partners and more funding to do the work.
That's great.
Given the interest in the survey on the mental health of both parents and their children, and the work of First Fives throughout the state to do that, I'm curious if there are particular practices or programs that you think are maybe missing in the community.
Yeah, certainly. Would love to follow up with you, but ones that come to mind are early childhood mental health consultation within classrooms, early identification and screening, referrals. Two big ones that First Fives have been implementing. I will say I was pleasantly surprised to see early childhood mental health so highly advertised. We hadn't seen that before.
Also speaks to sort of the acuity of the challenge. Well, I saw COVID too, right? Thank you very much. All right. Before moving to public comments, I'd like to, oh, she's not here. I was going to, oh, she is. Oh, there you are. Welcome, Commissioner Paz. I'd like to invite Commissioner Paz to provide an update from the Public Education and Outreach Advisory Committee. And while there are no items on today's agenda related to the media campaign or public relations work, we wanted to provide fellow commissioners with a report on the work of the PEO Advisory Committee. Commissioner Paz?
Yeah, okay. So public policy advisory, correct?
No, the Public Education and Outreach.
Okay, apologize. I'm having a hard time hearing a little bit here. Yes, thank you very much, Commissioner Hazen. So our committee, Public Education and Outreach, met on January 12th, and we received comprehensive updates on First Five California's current media efforts. The update was intended to ensure the committee is informed of the depth, strategy, and impact of the work, even though a formal media presentation is not scheduled for this meeting. I'll provide a few key highlights of that meeting. We received an update on First Five statewide media and public education efforts under their current media contract, including campaign progress, evaluation findings, and upcoming activities. The committee reviewed the overall Stronger Starts campaign framework, which is grounded in established public health models, including stages of change and educational scaffolding. The campaign has progressed from educating parents and caregivers about toxic stress to helping families recognize how toxic stress shows up in their own lives, and is now focused on the address phase, which emphasizes practical, strength-based actions families can take to buffer children from toxic stress. We also discussed the results from a third-party evaluation, which demonstrated strong movement from awareness to understanding to action. Findings showed a 2.4 times increase in the perceived relevance of toxic stress to families' lives, a significant increase in understanding of toxic stress, and a substantial rise in caregivers actively seeking ways to help children manage trauma. Additionally, an update on creative testing and development was provided, including focus group testing across diverse communities. A concept titled "Don't Cry" emerged as the strongest performing message across English and Spanish language audiences due to its emotional resonance and relatability. Production of 60, 30, and 15-second versions has been completed with statewide airing planned for March of this year. The Public Education and Outreach Advisory Committee also reviewed progress on media placement and relaunch efforts, including a 360-degree media strategy encompassing television, radio, streaming, digital, social, and out-of-home advertising. Engagement across platforms was strong, demonstrating meaningful interaction with campaign content. Update on Stronger Starts Learning program were also provided, which resumed in May of 2025 and has engaged hundreds of active learners and thousands of completed lessons. Partnerships with libraries, early childhood partners, and community-based organizations continue to expand access to learning opportunities with consistently positive feedback from participants. Lastly, we discussed community engagement efforts, including the Reimagine Stronger Starts Roadshow, a family-friendly, ADA-compliant activation designed to support parents and caregivers while creating welcoming, sensory-focused spaces for children. The Public Education and Outreach Advisory Committee noted strong county engagement and collaboration, with the Roadshow already activating in 23 counties, reaching tens of thousands of families and receiving positive feedback from parents and local First Five partners. Thank you.
Thank you very much. Is there any commission discussion of this?
I just wanted to thank the Public Education and Outreach Committee for making an effort to collaborate with the community, with the local First Fives, when engaging in their areas.
Thank you very much. And also I received a note that folks joining us on Zoom may not be able to hear us well. So for everybody in the room, I'm going to ask us all to speak as loudly as possible, and to commissioners joining us remotely, please let us know if you have any trouble hearing us as we continue with the meeting. Okay, we will now move on to public comment. Simon, do we have public comment, and can you share my?
Yeah, is there any in the room? And any in the virtual queue? Anyone raising their hand via Zoom? Yeah, we have none.
No. All right. Thank you very much. We'll now move on to.
Do we want to ask those remotely if they have anyone?
Oh, I thought you were asking. My apologies. For those joining us, commissioners joining us remotely, do you have anyone who'd like to share public comment?
We do not.
We do not.
No.
Okay. Thank you all. All right. We'll now move on to item 3, the election of the 2026 vice chair and advisory committee assignments. I'd like to invite Anthony Payne, First Five California Chief Counsel, to present this item to the commission.
Thank you, Vice Chair. Good morning, everyone. As the commission's bylaws state, the January meeting is the one where the vice chair is selected for the year. And this being the January meeting, this is now the item in which we will The commission will appoint a vice chair. To that end, are there any nominations for vice chair?
I would like to make a nomination.
Okay, Chair Albright. And whom do you nominate?
I would like to nominate Vice Chair Hazen.
Are there any other nominations? Hearing and seeing none. You are free to make a motion if you want.
So I,
Ask.
yes, no, I accept, and I am looking for a motion to approve my election as vice chair.
So moved.
Well, I was going to say, I'm thrilled to make the motion. I'll second it. But as you can see from the engagement and quality of this meeting, I'm so grateful to you for leading it and thrilled that you've accepted the possibility of being nominated, Vice Chair Hazen. Thank you. I'll make the motion or the second, whatever's appropriate.
I'll second your motion.
Okay, so we have a motion and a second. Is there any public comment? Simon?
There's no one in the virtual queue. Unless there's anyone here in Sacramento.
Is there anyone in Washington, D.C.?
There is not.
Fresno?
No.
Or Stanford?
There is not.
Okay, thank you. Lisa, can you please call the roll?
Yes, Shayna Hazen,
Aye.
Amy Bernardino Fabi,
Aye.
Elsa Jimenez,
Aye.
Katie Albright,
Aye.
Vivian Paz,
Aye.
Chris Perry.
Enthusiastically, aye.
Thank you. The motion passes unanimously. I will now again defer to Chief Counsel Payne to present the advisory committee assignments.
Thank you, Vice Chair. You will see that on the screen here are the different committees. And if we could move to the next slide that has the staff recommendation for participation in the committees. This would be the proposed staff recommendation for membership in the various committees, Vice Chair.
Okay. And do you want to read through them?
I'm happy to.
Yes, please.
So for the executive committee, we have Chair Albright and Vice Chair Hazen. For the Public Education and Outreach Committee, we have Commissioner Fabi and Commissioner Perry. For the Fiscal and Audits Committee, we have Commissioner Jimenez and Chair Albright. For the Public Policy Committee, we have Commissioner Paz and Commissioner Sood. And for the Program and Evaluation Committee, we have Vice Chair Hazen and Commissioner Paz.
Thank you. So as a reminder, I just started wearing glasses and apparently I need them. So thank you for reading that to us. And also for anyone who may be visually impaired, appreciate you reading that aloud. Is there a motion to approve the 2026 advisory committee assignments? Thank you. And I can't see it. Okay, that was Commissioner Paz with the second. So we have a motion and a second. Is there any public comment? Simon?
None virtually, any in Sacramento? No.
Any public comment in Washington, Fresno, or Stanford?
There's not.
No.
There is not.
No.
Thank you all. Lisa, can you please call the roll?
Yes, Shayna Hazen,
Aye.
Amy Bernardino Fabi,
Aye.
Elsa Jimenez,
Aye.
Katie Albright,
Aye.
Vivian Paz,
Aye.
Chris Perry.
Aye.
Thank you. The motion passes unanimously. We will now move on to our consent calendar. Items on the consent calendar typically include prior commission meeting minutes and ratification of contracts that were either previously approved by the commission or fall at or below the $150,000 threshold established by commission bylaws. Consent items are to be considered routine and will be enacted by one motion followed by a vote. There will be no separate discussion of these items unless commissioners request specific items be removed from the consent calendar for separate discussion and action. Any agenda item removed will be voted upon following the motion to approve the consent calendar. As a reminder regarding ratifications, the California Children and Families bylaws state the First Five California Executive Director and the Chief Deputy Director have delegated authority from the commission to enter into or amend contracts of $150,000 or less that are deemed necessary and appropriate to carry out the provisions and purposes of the California Children and Families Act. For all contracts in excess of $150,000, after the commission has authorized expenditure for such contracts, the commission delegated to the executive director and their designee the authority to award and enter into such contracts. Once executed, all agreements in excess of $5,000 must be ratified by the commission. Does any commissioner wish to pull an item from consent?
Can we ask clarifying questions versus having it removed from the list?
Let's pull it if you'd like to discuss it. But which is the item?
2 ratifications. They're just clarifying questions.
Okay, so can you name the ratifications so we can pull those out and vote on everything else first?
Yeah, the first one is the CHIS survey to UCLA, and the second one is the Securing the Futures conference to CCRC.
Okay, so we're going to pull those 2 items for further discussion. Does anyone else have other items they would like to pull? Okay, thank you. Do we have a motion on all items in the consent calendar except for the 2 that have been pulled?
So moved. Jimenez.
Thank you. And do we have a second?
Second.
Thank you. We have, I'm going to go with the one in the room because I heard it first, Commissioner Bobby. So we have a motion and a second. Is there any public comment, Simon?
There is no public comments in the virtual queue. Is there any public comment in Sacramento? Nope.
And any in Washington, Fresno, or Stanford?
None in Fresno.
None in DC.
None in Stanford.
Perfect. All right. So we're going to go ahead and vote on majority of the consent calendar. Lisa, can you please do a roll call vote?
Yes. Shana Hazen,
Aye.
Amy Bernardino Bobby,
Aye.
Elsa Jimenez,
Aye.
Katie Albright,
Aye.
Vivian Paz,
Aye.
Chris Perry.
Aye.
Okay, and now we'll take up the ratifications of the CHIS survey and securing the futures conference. We can take those up together. Commissioner Perry?
Thank you. My first question regarding CHIS is the amount that's being ratified and whether or not it is the total amount that will be ratified, or are additional ratifications coming as $4.5 million was approved over 3 years a year ago. This is 2.7 million. My question is this the total amount, or is this a partial amount?
Thank you. And I think Executive Director Wong, I don't know if you'd like to speak to this or invite.
I invite our contract manager, our research scientist, Dr. Riddell Fabian, I will to respond because he is managing the contract and has the details.
And I think if you can, because I know sound is an issue, reintroduce yourself so that everybody who's joining us remotely can hear.
I believe Fabian, research scientist here at First Five California. So a year ago, 4.5 million was approved by the commission. As of this month, 2.7 million has been the total amount for the contract. However, we are looking into making some modifications on that. We're working on it, so that amount might go up by a couple 100,000, maybe 100,000 up, since we are planning to add new questions for the 2027 survey. So that was the initial contract for 2.7 million as of October of last year, but that amount will change.
So
Why do,
it's partial.
why do we want to ratify an amount before we know the total amount?
Because we would like to include a few more questions that was brought up to us by CHIS and some of the internal discussions that we had as well. So some questions that were not included in the 2025 CHIS survey, and they were not gonna be funded in 2027 by some other outside contractors or CDPH perhaps. So First Five California would like to perhaps fund some of those questions. Specifically ACEs, to be more specific.
And we've been in conversation with Chiz, given the changing landscape of research and data inclusion. So even though it may be higher than a couple 100,000, depending on the needs and who else, other state departments who may or may not be able to contribute to the Chiz survey. Those are active conversations. So this is a partial that has a clear scope. And again, being good partners to our state agencies, we want to make sure very clear from the commission that we're leveraging those opportunities with other state agencies as well.
I understand. However, if more than $1 million is not going to be needed for this purpose, and it's the beginning of the year, and we are already talking about so many unmet needs and so many challenges facing families right now, I just wonder if the total amount that was approved earlier is in excess of what you'll ultimately need, and an adjustment should be considered to the total budget because there are so many other unmet needs. It's off by more than $1 million. So it does seem like, well, I would like to give you the feedback that if you've identified maybe only needing $3 million, that remaining 1.5 million be put back in the account it came from soon, so we can see it and think of other ways to use it.
Thank you, Commissioner Perry. Appreciate you flagging this. And I think just for clarity, maybe it's clear for everyone, but just ensure. So we're being asked to ratify the $2.7 million for the scope of survey questions we had initially planned. Additionally, we are exploring an expanded scope to include questions around ACEs and immigration that we and CHIS had expected might be funded by another entity, but will not be, which if we want those questions asked, likely would require First Five to fund those questions. And we don't have a final price tag yet for that. And what I'm hearing from staff is they would like the latitude to use the remaining amount in the contract to negotiate what it'll cost to fund those and then come back to us with that final amount. Is that accurate?
Which may not be up to the 4.5 to what Commissioner Perry spent. We hear that if we don't use that full, those will go back to the general fund. That's noted.
Great. So I think if we can, is it reasonable to have an update at the April meeting about what the cost will be for those additional questions? And then your recommendation about what would be refunded and where that would, in which account that would go?
Yes.
Great. Does that satisfy you, Commissioner Perry?
And one other, I'd also like to know where who the other funder was that cannot fund those questions as part of that recap next time.
I think we actually have that answer today.
CDPH will no longer fund those questions.
CDPH?
Yes.
And this would not be considered supplanting if you're coming in behind another state department that isn't funding something.
No, they won't.
Are you sure?
I can confirm.
Okay, then I'm comfortable with this amount today and the report out next time. And I'd love it if Anthony could just double check that doing what you're proposing is okay.
Anything, I'd just like to point out, so I appreciate Commissioner Perry drawing our attention to this. There is a significant difference here between what it's going to cost and what, what was approved. And so I think also when you come back to us, a little insight about how we can sharpen our pencil and do a better job at estimating what these costs are when these funding requests are made of the commission. Yeah, on the front end. Right. And then I know you
Can
had oh, go ahead. Yes, Chair Albright.
Sorry. Can I ask a question about what is the government's negotiating power now that the amount of money is out there? How does this negotiation actually happen? Are questions, is there is there a sort of a quota in terms of every question costs a certain amount of money and that's a general known amount, or has the process that we've created allowed for the vendor to really direct what the contract scope and terms are?
We do have seasoned staff who are researchers, and we do negotiate those costs. Every question, depending on the complexity and the history of how much the data set, it's not a set per question. It is really the complexity of the question that we're trying to answer and whether or not they have true ability to kind of ask with fidelity and certainty to yield the data with a level of confidence that they want to put Chiz's name behind.
Thank you.
It depends on the question and how we want to ask it.
And I think I don't want to speak for Chair Albright, but I think implicit in what she's saying is that we want to use our dollars efficiently and maximize available funding for as many possible things that are aligned with our strategic priorities, even though the 4.5 being improved here. Okay, and Commissioner Perry, I know you had a second one on securing the Futures Conference.
Yes, in that case, I'm just also, it's hard for me to track the tally of support for conferences. So where are we in relationship to the amount approved? So if $150,000 was set aside and 10,000 is going to this event, how many other sponsorships have already been counted against the 150,000? And just double checking, this is not the First Five Summit. This is a completely separate convening. Sorry, I should have asked that first.
That is correct. I welcome Deputy Director De La Cruz to the podium to respond in terms of how we manage the 150,000 sponsorship. And that's something that Jamie Ann Lopez does monitor.
Yes. Hello, Commissioners. Good morning or good afternoon.
Not yet.
Still good morning? All right. Well, there's and I believe Jamie Ann may be on the call if she wants to hop on. Jamie Ann, feel free to jump in if I'm missing anything. But the current process, we can get to that number. I don't have it right in front of me right now, Commissioner Perry, but I'm happy to follow up with that number. But the current process of sponsorships is organizations submit a proposal of what that event or that sponsorship consists of, what the funding goes towards. And then we go ahead and internally review what that means if we want to go ahead and participate as a sponsor. And if it fits within our guardrails and our processes and expectations of an event. And just to clarify for everyone, just talking about the sponsorships, the overall purpose of us sponsoring small events, we can grant up to a certain amount. We have 150,000 to do so, is to amplify the awareness and the presence of First Five California and what we do. We're usually not just paying for some, a specific aspect of the event, but we're also using it as a branding opportunity to highlight First Five California, a message. I'll give an example.
And I hate to cut you off, but I am looking at time, and I think you've satisfied, the question, but I'll ask Commissioner Perry, do you have any additional questions or?
I apologize, but I didn't hear the answer to my question. I asked how much we've spent of the 150,000 that was set aside, and is the deadline for using that March 17th, when, in what period of time is that?
So I hear, thank you for clarifying again specifically what you're asking. And Director Wong has said they are looking into the specific number right now, and we will get it to you. But we want to make sure that we have it.
Right now, thank you, Jamie Lopez, who's just pulling up the data. She's a little bit ill today, so she's unable to be here in person. We have approximately 27 million left, and that is a June 30th deadline. So which is sufficient enough to cover current requests in the queue. Of that 27,000 left of the 150s.
You've spent all but 27,000 of the 150,000.
Yes, correct. And our deadline to spend is expend is June 30th, 2026.
Okay, thank you.
This includes everything in the queue that will be also ratified in the next meeting as well.
And I'm wondering, Commissioner Perry, moving forward, is there additional information related to this expenditure that would be helpful for you to see, so that things are clearer moving forward?
I think it's helpful to put the sort of where we are in the where we are in relationship to the ceiling. So what I asked today, I think it's helpful to see how close we're getting. I also know that these requests are probably fairly often or frequent, and there are judgments being made about which to do or not do because you have a finite amount. So if they go on consent, I think it may be that we ask why that group, why that event. So maybe adding a little bit more information about why could help make it easier to approve in the future.
The last couple of years, we created a logic model on the sponsorships versus the same people we fund over. We don't necessarily, because we fund them, we'll always fund them. So happy to discuss that logic model as to how people get chosen and the level at which we sponsor. We don't always sponsor at 9,999. Sometimes you sponsor at a lot less. So
it sounds like so I'm hearing a couple things. So one is, how much have we spent towards the total amount that's been approved? And then secondly, an explanation of why each sponsorship was decided on.
That would
a lot.
Yes.
Yeah, that'd be terrific. And if it's time to approve an amount again, it'd be helpful to know how many requests you had to deny or decline because we didn't approve enough, if that's the case. So when you come back, it would be nice to get sort of a recap of how much supply there was versus, or demand versus supply.
That's
we'll
great.
make sure that happens.
Thank you very much for that feedback. Right, so now we need to go ahead, any other feedback on these two items? Okay, so we're gonna go ahead now and vote on the ratification of the CHIS survey and securing the Futures Conference. Is there a motion?
So moved.
I move to approve these two items.
Thank you. So we have a motion from Commissioner Perry and Chair Albright. I heard you jump in. May we count you as a second?
Yes, you can.
Okay, so we have a motion. We have a second. Lisa, can you please do a roll call vote?
Yes. Shayna Hazen.
Aye.
Amy Bernardino Bobby.
Aye.
Elsa Jimenez.
Aye.
Katie Albright.
Aye.
Vivian Paz.
Aye.
Chris Perry.
Aye.
The motion passes unanimously. Thank you, everybody, for your feedback. I will note that we are a little behind schedule, so we're going to see if we can make up time and also may need to cut lunch a little short. But we're going to move to item 6, which is our state and federal advocacy services scope of work. This is an action item. I'd now like to invite back Commissioner Paz to provide an update on the Public Policy Advisory Committee and Jorge de la Cruz, Director of External Governmental Affairs, to present this item. Commissioner Paz?
Yes, thank you, Commissioner Hazen. So the Public Policy and Advisory Committee met on January 12th and receive comprehensive updates on First Five California state and federal advocacy scope of work, which are intended to guide contracts that will commence following the conclusion of the current advocacy contracts. The committee revisited a motion from the previous commission meeting to approve up to 1.3 million for state and federal advocacy support with final approval of the scope of works to be provided by the commission. As discussed at the prior commission meeting, the purpose of this motion was to ensure that the scopes of work reflect a collaborative tone, affirm First Five California's commitment to dedicating internal resources to state and federal advocacy, and welcome proposals from consultants who support organizations with similar missions in order to extend impact and leverage resources. Staff provided an overview of how the team developed both state and federal advocacy scopes of work, incorporating the initial feedback provided by the commission. All commissioners were provided with the scopes of work, and staff welcomed and encouraged feedback. Prior to today's commission meeting, all commissioners received the final state and federal advocacy scopes of work for consideration, and the commission is scheduled to vote on those scopes of work today. Jorge?
Commissioner.
Would you like to make your presentation, Jorge?
Yes, I will. Thank you so much, Commissioner. All right, so like Commissioner Potts mentioned, I'll provide just reiterate a little bit of that background, which is that at the commission meeting held November 13th, 2025, First Five California
Can I ask, sorry, because I think people are still having trouble hearing. Do you mind pushing the podium further forward so we can get as close to that microphone as possible? Thank you.
Getting my
little
legs in.
exercise, that's right.
That might actually help. All
right.
All right, so no problem. So as I was saying, last commission meeting, November 13th, 2025, the First Five California staff, we sought approval from the commission of up to $1.3 million over 3 years for state and federal advocacy services. Shout outs to Salinas, California. The commissioners agreed on the need to continue our advocacy efforts, but did raise concerns about the state and federal scopes of work intended to guide contracts that will commence following the conclusion of the current advocacy contracts. They wanted for us to ensure the following. First, to reflect that the scopes of work reflect a collaborative tone. Also, that it affirms, or that they affirm, that First Five California is committed to dedicating internal resources to state and federal advocacy. And lastly, that we will welcome proposals from consultants who support organizations with similar missions in order to extend impact and leverage resources. After discussion, a motion was made at the last commission meeting to approve again the 1.3 million for state and federal advocacy support with scopes of work to be approved by this commission today. And the motion again was approved at the meeting. Since then, we went ahead and developed the scopes of work. Now that we did have the approval of the funds, and we went ahead and developed both the state and the federal advocacy scopes following the meeting, incorporating the initial feedback provided by the commission that day. Commissioners then, once we had the language created, were provided the draft scopes of work in December to allow time for review before this commission meeting today. And then we went ahead and incorporated all additional edits and suggestions, creating a final version of the scopes of work, which was provided to the commissioners, and everyone has seen. Commissioners were provided with the final scopes of work, again, prior to this commission meeting. And today we request approval of those scopes of work for state and federal advocacy services, which authorizes staff to proceed with the competitive procurement process to secure expert advocacy partners to advance our policy priorities and strategic plan. And any questions to that?
Are there any commissioners that have any questions on the state and federal advocacy services scopes of work? And I do want to note, and again, this is just for clarity and, Chair Albright, did you have your hand up?
I did. Thanks so much. I think this might be a question for Director Wong or our General Counsel. Could you clarify the public notice on this? I think we had a question in advance about whether or not the necessary materials were posted and if they were posted in the correct way. And could you clarify how the commissioners received the scope of work?
The Bagley-Keene requires any documents that are to be discussed and voted on at a commission meeting to be posted in advance of the meeting. That was satisfied.
But I don't.
Does that answer your question, Chair?
I don't know if that's accurate. I guess if I can add on, I didn't see the actual scopes of work document aside from what was emailed to me until I think was it added today?
Yeah, prior to the meeting.
Okay.
Yeah, so the deck had been included, but I think we had forgotten to actually upload the scope of work document until this morning.
Okay, is Bagley-Keene requires the scope of work to be posted, since that's a document that you all are voting on, that document be posted in advance of
So it sounds like we can't vote on that today.
Well, if it was posted in advance of the meeting, you can't.
Anytime in advance of the
Yes,
meeting?
yeah.
I see.
The agenda, I think, is what needs to
The
be.
agenda, yeah. Oh, I thank you, Commissioner. The agenda under Bagley-Keene is required to be posted 10 days in advance, 10 calendar days in advance. The documents that are associated with any meeting needs to be posted in advance of the meeting. So that does not have a 10-day requirement.
So
if that clarifies that.
Got it. So up to any number of minutes in advance, just for clarity.
Yes.
Okay, so we have satisfied that. And I just want to say, my hope is that it would have been posted earlier, but I know moving forward, we'll make sure that that would happen sooner so that members of the public have access to that information and time to review it. But thank you, Chair Albright, and to our General Counsel for clarifying that. Are there any other questions from commissioners?
I don't have a question, just a comment. Particularly in today's climate, the more that our state association can align, our state commission can align with the First Five Association and with the locals in terms of what we're going to be advocating both at the state and federal level. I feel that more emphasis that may be put in terms of elevating the need to invest and fund strategies in First Five, so that we're all moving to the state too. I would just ask that staff do that as we roll this out and bring on the advocacy firms.
Thank you. And I just realized procedurally, I haven't called for a motion before I asked for discussion. So do we have a motion so that we can actually discuss this item and take their remaining questions?
I move approve the.
And I'll second Jimenez.
Thank you. Commissioner Perry has made the motion. We have a second from Commissioner Jimenez. Okay, now that we have that, Chair Albright.
Thank you so much. I just wanted to respond to Commissioner Jimenez's recommendation and add a +1 on it, as well as say I am lucky to serve with Commissioner Paz on the policy committee, and our recommendation was exactly that, to ensure that First Five Association as well as the community at large receive this before it's finalized. I think one of the things that we're challenged by is, as a state commission, we need to go through a procedure. So even to have this discussion needs to be publicly noticed. So and to have, to really get into the conversation. And our intent is to do the needed partnerships so that we can collectively align around what a policy agenda looks like for the state of California, and we can move together with our partners in doing that. And Director Wong, I know you've thought about this a lot, and welcome your addition on this as we think about it. But I think we're a little challenged in terms of the procedural order of how to do something like this.
And I'm happy to provide some context, Chair and Commissioners, on that. Adding a plus to your plus, that's absolutely right. I mean, there was never a time when we were not considering not only the networks policy, policy endeavors and needs that were outlined actually the association's website earlier, as we discussed, but also the partners across the board, because you're right, Commissioner, it is a tough moment where not only the network, but the ECE Coalition, for example, the Black ECE Coalition, and all of our partners that we consistently work with, that are our sister agencies as well, seeing what the needs are, what the temperature is in the water, and aligning those efforts throughout last year, and as we drafted the language for the scopes of work. All of those discussions were taken into consideration. The discussions around advocacy, the needs, what we're looking at in early childhood education across the board, what those needs are looking like. And the discussion, for example, about immigration, is that something that's early childhood education focus? Is it California focus? And then is there a need? And now across the board, for example, yeah, we agree, majority that, yeah, I mean, all children, right, are now being affected. So not only, have we taken the network and all of our partners into consideration when these new consultants are brought on after the end of these contracts, we are going to continue considering all those conversations and making sure we're aligned in efforts. Executive Director?
I mean, that is correct. We have being the unifying voice in terms of not just the First Five network. We do have our state agency partners, our ECE Coalition, our anti-poverty advocates, our Working Families Coalition. We work across. I mean, that is the magic of First Five, being able to bring a large swath of constituencies, voices, and really distilling what really rises top across different groups. And so that is the power of First Five California and the California Children and Families Commission.
Thank you, and thank you everyone for sharing that feedback. I have just a final question, technical one around timing and around when our current any current contracts we have are ending, if there are any gaps in services that we anticipate. I know there was mention of spring 2020, early 26, spring 26. When do we expect to be able to get these RFPs out and contracts executed? What's our goal there?
Well, that's a great question. So if the scopes of work were to be approved today, we can get to work tomorrow in getting those scopes of work, those RFPs out, because there are two, and clarification, there are two different contracts, one for state and one for federal. The state one, that our current contract expires in March, and our federal contract expires, I believe, in June. So we want to make we are able to get those RFPs out in time without there being a gap, if we are to start getting those RFPs ready starting tomorrow.
Terrific. And I would just, say if we can prioritize that state contract and getting that out as quickly as possible so that we don't have a gap, because I hear you saying there won't be a gap, but it's almost February. And if the other one ends in March, that's like tomorrow. And this is critically important work. So just I know everybody's working as hard and as fast as they can, and capacity is limited. But I really want to make sure we don't have that gap. So with that, if there are no further questions or discussion from the commission, do we have any public comment, Simon?
No public comment in the virtual queue. Is there anyone in Sacramento?
Yes, please.
Thank you, commissioners, and thank you for the recognition of the opportunity to collaborate on advocacy and the association being involved in this process, given our shared brand with the First Five California Commission, our shared policy agendas. There's a lot of overlap, which I know you'll all be talking about with item number 9, the shared tables we sit at, the relationships that county commissioners also have with state legislators, and also the stake that is stakeholders. 58 county commissions have a lot of stake in what happens at state and federal levels. And so because of that, we would recommend as the association to ensure that both scopes of work contain some language that requires some coordination with the First Five Association and its own lobbyists, because we also have our own advocacy consultants. And we also further recommend that there's some regular meetings with the federal consultant, as we had done in the past. The association would have regular meetings with the federal consultant, because that is the one source that county commissions have to what's going on in Washington, D.C. We don't have any other federal contractors. And so we really do rely on First Five California's investment and of getting that information flow. So we would recommend those 2 things. Thank you.
Thank you. Do we have any public comment in our remote locations in DC, Fresno, or Stanford?
None in DC.
Not in Stanford.
None in Fresno.
Right, and we have a motion and a second to approve the scopes of work that are included. Want to make sure those still stand. Okay, so let's go ahead and take a vote. Lisa, can you please call the roll?
Yes. Shayna Hazen,
Aye.
Amy Bernardino Bobby,
Aye.
Elsa Jimenez,
Aye.
Katie Albright,
Aye.
Vivian Paz,
Aye.
Chris Perry.
I
Thank you all. That motion passes unanimously. And again, thank you to the team to coming back to us with those scopes, and look forward to getting some new contractors on board doing the work. We will move to item 7, California Children's Data Presentation. Reference this at the top of the meeting, but really this is an opportunity for all of us to have access to the latest data and insights to guide our work moving forward this year. I'd like to provide an update on the Program and Evaluation Advisory Committee. And then I'll invite Dr. Juan Lee, First Five California's research scientist, to introduce our guest presenting on the data information item. During the November 2025 Program and Evaluation meeting, our committee was provided with an overview on the progress of the commission-approved partnership with the Children's Data Network and California Strong Starts Index, including a preview of the data dashboard. This investment is aligned with the Commission's goal to understand our population level impact on our identified field indicators in the strategic plan. During the January 2026 Program and Evaluation Advisory Committee meeting, the Stanford Rapid Survey team presented to us their caregiver survey findings, showing high material hardship and emotional distress, with discussion of sampling limits, understanding parent caregiver trends over time, age-specific childcare impacts, both in TK and after school, and cross-state comparisons. The group discussed the potential for expanding statewide surveys to get a broader perspective on these issues. And with that, I'd like to welcome Dr. Juan Lee to share more and introduce our guests.
Good morning, Commissioners. Today's item highlights 2 important efforts that are strengthening California's understanding of the needs of children and their families. I'm pleased to introduce our partners from Children's Data Network and Stanford Center on Early Childhood, who will be sharing their work with you. You will hear about Strong Start Index, which offers a neighborhood level view of the conditions shaping early childhood outcomes, and findings from the Rapid Survey Project, which brings forward the timely insight from the parents and caregivers across California. So together, these efforts help address a long-standing gap in statewide data by centering the prenatal to age 5 period and elevating the both systems level indicators and family voice. This work is closely aligned with our strategic plan, particularly our commitment to advancing equity through evidence and grounding decisions in both data and the lived experience. It also connects directly to the theme of our first commission meeting of the year, focusing on safe, stable, nurturing beginnings by helping us better understand where conditions support the healthy development and where additional attention and partnerships are needed the most. So joining us today are Dr. Reagan Faust from Children's Data Network, whose work focuses on using linked administrative data to better understand the experiences of children and families, and also advance the equitable policy solutions. And from Stanford Center on Early Childhood, we are joined by Dr. Phil Fisher, a nationally recognized expert in childhood development and the prevention science, and Abigail Stewart-Kahn, who leads the work translating rapid survey findings into actionable insights for the policymakers and the early childhood leaders. With that, I'll now turn it over to our partners to walk you through their findings.
Thank you. And before those presentations, I want to make sure commissioners are aware, so we'll have 2 presentations. And I ask that everyone please hold your questions. I'm sure there will be a lot. And after each presentation, we'll have time to ask those questions, get those answers, and then move on to the second presentation. And with that, I'd like to welcome our guest presenter.
Thank you so much. Perfect. Just wanted to make sure it was running the slides. Thank you, Dr. Lee. Again, my name is Reagan Faust. I'm the Executive Director of the Children's Data Network. We are a university-based data and research collaborative that specializes in the linkage and analysis of administrative records. So first, on behalf of my colleague, Emily Putnam-Hornstein, Jacqueline McCroskey, and the entire CDN team, because it takes a village, I wanted to express my appreciation to Director Wong and you, the first 5 commissioners, for this unique opportunity to share my perspective on the status of children in California through the lens of our joint project, supporting a strong start for California kids, and to present alongside and learn from my esteemed Stanford colleagues. So this work, supporting a strong start for California kids, ultimately aims to highlight and address inequities among babies born in California. Also, reduce the risk of adverse outcomes for those children and connect families with the supports they need through the use of novel administrative survey and analytic approaches. And it all rests on the Strong Start Index. So I thought I would start there. If we could progress the slide. Thanks. So let's start at the beginning. And I love this picture, right? With birth. Every year, there are more than 400,000 babies born in California. And each birth generates a record. So if we could progress. And on those birth records, a decent amount of information is collected. So you have information about maternal and infant health, including birth weight, healthy health outcomes, conditions that could have implications for future outcomes in advancement. You also have sociodemographic information, including parental educational attainment, need for nutritional assistance. You have geographic information, and importantly, it's not just information about the infant, it's for the family as a unit. And essentially, birth records are a snapshot of the constellation of resources available to individual children at the time of birth. And when combined, they can form a rich data set that could be used for prospective and also very local analyses for entire populations of babies born in California. Next slide. So in an effort to leverage this information for program and policy purposes, and with the generous support and thought partnership from First Five Association, First Five Los Angeles, Heisman Simons Foundation, and now First Five California, we combined key elements of birth records to form the California Strong Start Index. It comprises 12 indicators present on each child's anonymized birth record that are standard across years, populated consistently, and as you can read, are theoretically and empirically related to good outcomes for children along the life course. So when those scores are summed at the child level, aggregated up to the census tract level, and then visualized in various ways, and for populations of interest, information on birth records can further our understanding of the distribution of resources among California communities, highlight disparities, and facilitate more equitable investment. So in general, babies in California are born with an average of 9 of the 12 Strong Start resources. This has been pretty consistent across years. But when you get down to the very local level, there's quite a bit of variation, as you would expect. According to 2023 data, babies born in San Mateo County, so this is the county with the highest level of average scores, they had on average more than 10 Strong Start assets, whereas babies born in Yuba, Sierra, Sutter, and Imperial counties, so counties with the lowest average scores, had on average 7.4 fewer. If we were to zoom within counties, however, you can see the conditions into which babies are born can differ dramatically even between neighboring communities. San Diego, San Jose, and Pasadena, if we could go back just one slide, please, are just 3 examples. It's all right. Oh, okay, perfect, thank you. And if we were to look at the data in a different way, so not as averages, but actually as buckets, right? Of 11 or 12 assets, 9 or 10 assets, and 0 to 8 assets. So these would be the babies that would be considered most vulnerable. Disparities become even more apparent. So it turns out that babies, that California births are pretty equally distributed between 8 or fewer assets, you know, those buckets, 8 or fewer, 9 or 10, 11, 12, with about a third in each. And that places the likelihood of falling into one of those buckets about equal. However, you can see that when comparing the county with the highest and the lowest average scores, the distributions of birth in San Mateo and Imperial counties look really different. In San Mateo, more than half of all the babies born had 11 or 12 assets, whereas in Imperial, only about 4% did. So I should point out, though, that even in San Mateo County, even nearly 20% of the babies could be considered vulnerable, right? So we must, so just because a county has a high average score or the skewness toward a high asset range, it doesn't negate the real need that exists for those babies born in the communities. And now if we could proceed. Thank you. So not surprisingly, when the data are disaggregated by race ethnicity, we can also see the consequences of systemic and structural racism. Again, California births are pretty equally distributed between those 3 buckets, but Black, African American, and Latino babies born in 2023 were most likely to have 8 or fewer assets. Asian Pacific Islander and white babies were most likely to have 11 or 12. And importantly, through child level validation, we know that this variability is not inconsequential. By linking birth records for an earlier cohort and then following them forward for the first few years of life, we find a strong graded relationship with the predicted probability of child protection involvement and death before age 5. So specifically, 53% of babies born with 3 assets were reported for alleged maltreatment before the age of 5, compared to 3% of babies born with 12. You can see the strong inverse relationship with child death as well. The death rate for children born with 3 assets was 6.4 per 1,000, compared to less than 1 per 1,000 for babies born with 12. So overall, The lower the Strong Start score with which a child is born, the higher likelihood of leads to objectively bad outcomes. So given its validity, hyperlocality, and how quickly we're able to update the Strong Start website as new cohorts of children are being born, the Strong Start Index has become an important tool among policymakers and advocates. So it's been used to prioritize communities for investment, inform the expansion of family strengthening and early childhood supports, assess the need for and availability of resources, such as home visiting, and actually more accurately estimate the number and types of slots that could be needed for each type of family. Examine racial and ethnic and geographic disparities, inform organizational planning and evaluation, and advocate more generally on behalf of children and families. So, okay, we got this tool. It's consistently updated. Its scores are related to real life child outcomes, and it's being used for budgeting and to facilitate equitable allocation of services and supports. So overall, what does this data tell us about the children, how children are faring? Well, what we can see is that despite the resources available in California, a substantial proportion of children are at risk of poor outcomes. What we also know is that from our previous research is that often the children who are most at risk of those bad outcomes are least likely to engage in the services designed specifically to mitigate them. And so in order to really move the needle in terms of mitigating risk and improving outcomes for children in California, we need to know why. So what services were offered? Were the families, were they what families needed? Were they what they wanted? Were there barriers to access? Did they have a bad experience with another program that influenced their willingness to engage, or maybe they just didn't have time? But our lack of understanding about the needs and experiences of those families who are at high risk of poor outcomes, but not engaged in services, hobbles our efforts to align needs and supports, evaluate and improve programs, and refine those engagement strategies. And it was this realization and this focus on this fewer than 8 part of the spectrum that inspired our next steps for the Strong Start Index and the genesis of the Supporting the Strong Starts for California Kids project. So with your generous support and help from First Five County Commissions and the association over the next 2 years, instead of looking backward to understand the asset profiles of California communities, we're looking forward. So we've secured approval from the state's IRB, institutional IRBs, and the data provider, the California Department of Public Health, to receive birth records prospectively on a monthly basis for 6 months starting in March, which will be tomorrow. We will apply we will apply the Strong Start coding schema to those records to develop a population-based sample of parents who recently gave birth in California. Then we're going to be reaching out to those families to collect information about current service needs and experiences, as well as other sociodemographic information like household composition, experiences of ACEs, need and experience for childcare. Respondents will receive $21 for their participation in this 10-minute survey, and critical to this work will be a specific emphasis on engaging families of children on the lower asset part of the asset spectrum. Cross-sector record integration is also on the horizon, which makes this project unique and, in our opinion, increasingly valuable given the changes in state and federal data landscape. So the results we hope will shed light on the number of new mothers reporting these adverse experiences during pregnancy or shortly after birth statewide, their engagement in available community-based services and supports, and what they say they need during this critical period. They will also advance our understanding of the relationship between the Strong Start scores and adverse childhood experiences, including child protection involvement and death, as well as those reported by mothers around the same time of birth. So ultimately, we're really excited because the findings promise to fill a major gap in our understanding about the needs of our most vulnerable families, in particular, make our efforts to improve children's outcomes more intentional and equitable. And I'm excited to say that we should have findings for that part of the work in spring or summer of 2027. And I should also say that one of my dreams is to have response rates that would allow us to produce findings for each county in California, right? But with everything going on at the federal level, and just the nature of survey research and expected response rates, we've built in a fail-safe in case response rates are low. So we actually launched a parallel data collection effort with First Five County Commissions, and thanks to the great support of the First Five Association, the goal has been to collect information about the service needs and experiences of parents from every First Five County Commission. And that way, we should, no matter what, have something to say about the services and the supports available within each county, be able to highlight the innovative ways that First Fives are overcoming challenges and filling gaps. And I'm proud to say that 45 of the 58 counties have responded, so we're at 78%. So findings for that part of the work should actually be available this summer.
Wow.
So if we continue to the next slide, in addition to generating data about the conditions under which babies are born in California, and by updating the Strong Start website with each new birth cohort, and again, where the rubber really meets the road in terms of identifying what families on that lower part of the spectrum actually need, by collecting information about their service needs and experiences directly from them. This First Five California project also includes developing a data-focused landscape analysis that describes data that are and are not currently available about young children in California in order to identify prospects for data integration and opportunities for collaboration, guidance, and support. Also supporting record linkage and analysis through targeted technical assistance to our state partners. So most, namely the agency departments of California, HHS, the Cradle to Career Data System, the ESIDS and Full Child Equity Tool, and to First Five California in the form of indicator recommendations. And finally, facilitating thought partnership through project updates and a dynamic dashboard that I won't include in my presentation today, but it's included in the slide deck with a link if you'd like to check that out. So we are, I'm happy to provide more information about any or all of these pieces. Ultimately, our goal is to help develop data that will support a strong start for California kids, and we're thrilled to partner with you on this comprehensive, innovative, and inspiring work. And if we could go to the last slide, please. I was just actually one before. Thank you. I love looking at her. With that, I just would like to conclude with heartfelt gratitude for your generous support of this and other child-focused data projects. So I feel like I'm preaching to the choir here, but given this cultural moment in which we find ourselves, I think it bears repeating that data may not be sexy, but it is. Don't say that.
That's so great.
It's absolutely essential in order to improve conditions for children and families. So without it, we'd be effectively blind to their circumstances and unable to effectively help. So I can also tell you from my personal experience that if it were not for First Five's fierce backing, our work and much of this work in this space would be just disappearing entirely. So thank you, commissioners, for being consistent, courageous, and strategic standard bearers for the generation of data about young children in California. Your support means more than you will ever know. Thank you.
Thank you so much. This work is really, really exciting. We have questions from commissioners.
I do have a question, and I love data too, and I'm looking at your index and I love it. Question for you though, when we go down to the census tract, could we see the ethnic breakdown? Because I'm not, or maybe somebody can show me later how to navigate this. Because from my perspective, both in this role and as my regular day role, I would love to kind of further dig deeper into some of these. And for example, in some of our Monterey County census tracts, 100% of the kids born have 8 or fewer in that specific area. And I think this data could kind of help drive strategies that our local First Five and our local health department and others could align along to try to increase that number.
Absolutely. So yes, to answer your question, all of the data that are available, it's at an individual level. So there is the ability for us to look at racial and ethnic breakdowns at that hyperlocal level, but not actually produce that
on the dashboard. Okay.
Yes, due to confidentiality.
Sure. Okay.
But you know, thinking about ways to bring that to the fore, you know, if we were able to find a large enough aggregation, exactly, we would definitely be open to exploring that.
Okay, thank you. Of course.
Also, big fan of data, so. Appreciation. A few clarification questions. The 12, are you calling metrics or what you're anchoring on? Assets, sorry. What's the universe and how did you settle on the 12? And then I think on that slide, you mentioned that they're correlated with health outcomes and you presented some outcomes related to CPS involvement to death. What other outcomes?
Yeah, so back originally when we were trying to understand, are there, you know, first indicators that would be consistently populated across years, right? So, you know, we wouldn't be putting something in that would all of a sudden disappear or not be populated later. We wanted to really focus our search on indicators that had empirical relationships to outcome. So they were very discrete indicators. So like healthy birth weight, you know, and we compiled a whole list of here's the empirical evidence of it being related to future outcomes for children. And we went through basically the universe of information on the long-form birth record, which has hundreds of indicators on it. The ones that had the most evidence to outcomes has discrete indicators, as well as formed a cohesive set of something that if we were to look at them, they would have face validity, right? They were intuitive. That then when we organize them together as one unit, a holistic set, they also related to those two outcomes that we could track in administrative records. So all that to say, I'm happy to share kind of the earlier documentation that we have, kind of that looks like basically a literature review that documents the relationship there. But yeah, that's how we kind of came to those indicators.
Can I ask follow up to that just for clarity, just making sure I understand. And again, since there was lack of clarity, data is sexy, in case anyone's wondering. Separately, so these discrete sets of indicators are what are described now as the 12 assets, is that right? And then those are correlated to specific future outcomes.
Correct. So you'll notice that list. I wonder if we might be able to put the slide with the list of the indicators up. You'll notice that some are those discrete indicators, healthy birth weight. That is unchanged from the birth record. However, there are others that are combined with other indicators in order to almost have double coding, right? So where we have, it is socioeconomic. I think it's slide 4. There you go. Yeah, so in the financial section, we have born to a parent with a college degree, again, just a discrete indicator. However, born to parents with employment history. Now, that is a double coding in order to capture the socioeconomic kind of unit, right? And so some are changed, some are not, but you'll notice that, you know, in the documentation, it's all laid out. Does that make sense?
And I just want to jump in for clarity, but other commissioner questions or points of discussion? Maybe Dr. Sue wants to finish since I interrupted.
Oh, no, that's okay. So we can do that offline as well. I think maybe one of the other questions I was curious about is the granularity is always appreciated, right? If we go through the census tract data. And as a state, probably the other resource that we leverage the most is the Healthy Places Index. Is there cross-pollination, collaboration, integration between these two data sets?
Yeah, so in earlier work, what we did, what we consider individual level validation. It's that, you know, linking of data in order to understand, do Strong Start scores relate to future outcomes for children? So that's an individual level validation. We also did external validation, and we used the Healthy Places Index and the California Profile and some other indices in order to understand the Strong Start scores and the profiles we were producing and how they related to the Healthy Places Index. We actually found pretty good validation comparison between the two. But what we were seeing was that they were a little bit different, and that's great because what that means is that the California Health Places Index is actually capturing something different than what we were capturing, and what we're capturing is information specific to babies, you know, at the time of birth, whereas the Health Places Index is capturing community level and measures. So yes, some of that work has already been done, but no formal collaboration has been established.
I was never going to preserve it. Okay, and I see Chair Albright.
Thank you. I appreciate this report is incredibly valuable, echoing my colleagues. I wanted to actually just ask a point about the impact that you suggested was happening at the federal level. Could you give us an example of, and you were very gracious in thanking First Five in terms of our investment. And I think you said something like this work wouldn't be happening but for First Five, particularly given the federal constraints that you're seeing. Could you give us just an example of what you're seeing? I'm sure you could write papers on it, but just a brief example so that we have a sense of what the constraints are at the federal level beyond what we're reading in the newspapers.
Yes. What I would say is that from my perspective, an underreported experience of researchers is pressure to not talk about disaggregations for children specifically. Race, ethnicity, poor children, vulnerable children, all of those actually those words fall onto a list of words that, in my experience, is challenging to produce information about without receiving pushback from federal, but then also university level officials.
That's helpful. Thank you so much. I appreciate it. You don't have to go into more detail if that doesn't feel right, but it is helpful to understand where the constraints are coming in. It does sound like disaggregating data, and certainly if we're going to be equity forward, we need to disaggregate data. So very much appreciate both the local data that you provided geographically, as well as the race ethnicity data, and echoing what Commissioner Jimenez said about how important that data is.
Yes, thank you. And I would also add one of the ways that we have been able to continue this work and receive support from the people that it needs to receive support from is that we've been under contract with First Five California. So thank you.
Yeah. Thank you. Value add to that. The adoption of our Clear Strat plan related to equity and justice that is rooted in those root causes allows us to fund things like this. Because we know that ensuring the well-being of children in California, there are complexities. There are layers, and without the ability to disaggregate the data, how are we, and we had this conversation earlier, of how are we strategic about filling those gaps? And we had that conversation around CHIS, but again, pairing these data with some conversation we're about to have with Stanford allows us to really live out the mission, goals, and values of this commission, but more importantly, the strategic plan that you all adopted in the spring that is really clear about ensuring that our most vulnerable populations their needs are addressed explicitly. So I want to just thank the courage, and thank you for being kind, and the courage of this commission to adopt that so clearly.
Thank you.
Yep.
And any other questions or comments from our commissioners that are remote? Okay, I've got a few questions. One, and I'm not sure if it's a question for you, maybe more of a comment, but I'm wondering, and maybe Abba, I'm speaking to you, if there's an opportunity for linkage between what these data show, and I think particularly the new data that you were going to have over the summer around both assets and needs, and almost in real time. But how do we collectively make sure that gubernatorial candidates have access to this data and this information? And so I would just challenge those of us leading that work to think about how do we leverage this really rich data to help inform the Choose Children work and really to push those candidates on the urgency of the needs. Secondarily, this is an easy one. Are there precedents for this in other states?
Not that we've found. Yeah, we think that this is a pretty unique project, and it's an experiment in that way as well. So very interested to see how this proceeds.
So, and I think along those lines, because this is unprecedented and seemingly incredibly impactful, I wonder, once we have a sense of whether it does what we hope it has the power to do, how we can leverage our PR contract to really amplify what it is we're doing, because it seems really noteworthy and something that I hope is replicated, especially as we getting started this meeting hearing that child poverty rates are on the rise, not just in California but across the country. And so how do we leverage our unique position here and the innovative work we're doing here to try to push that work to other places, even though we are focused on California. And I guess also along the lines of sharing this with gubernatorial candidates, is there an opportunity for us? I mean, if data and insights are really available in the summer, to share information with legislators in the fall as they're thinking about their legislative priorities in the new session. The timing seems really perfect to be able to do that. So that's if that's a possibility, and maybe not explicit like this new state advocacy scope of work, but thinking about how these things all overlap and how we utilize the data we have access to really inform our policy agenda. And then lastly, hearing Commissioner Jimenez's questions about like, how do we dig in, how do we get more, because data is sexy and amazing and we love it. Do you provide webinars to users at the local level? And I don't know if that's within our scope of work, but what does that look like and how do we support that?
Thank you. So we have in the past, but haven't done one in quite a while. So
there's capacity for that and capacity. I mean, so, and I'm looking to see how those saying yes, please. But really thinking about like, how do we bring this to counties? And I would push us to think, beyond just sort of the first 5 network, but like, how do we make sure all stakeholders are, across counties have access to this data, and really thinking, I will say at the sort of the upper end of the, continuum, thinking about parents and families and entities that serve all of them. I think that was everything I had that you couldn't tell. I'm super excited about it. And really, really appreciate the work.
Commissioner.
Yes.
So I'm all about data disaggregation, looking more at what these categories or ethnic categories are. And, sometimes data is used to deny services to significant groups. Even though, and neglecting, what are the needs of, our more vulnerable populations. So I just want to throw that out there that, data can be used to, hurt different populations just because a majority look like they're doing well.
100% agree with you, and thank you for that call out.
Thank you so much. Appreciate your partnership. And I feel free.
Now we would like to invite Dr. Phil Fisher and Abigail Story-Khan from Stanford to share their findings on rapid survey project.
Well, thank you. Yes, absolutely. So Chair Albright, Vice Chair Hazen, and Commissioners, thank you for the invitation to be here. Also, Executive Director Wong, who is not only a Commissioner, but also serves as co-chair of the California advisory for our rapid survey. Thank you and deep gratitude to you for all you've done. You're really a powerhouse for the work that we're doing in the California survey.
Because data is sexy.
That's right. That's right.
This audience clearly needs to know,
That's actually, we're gonna generate new revenue by selling those t-shirts.
Excellent. I also want to thank the Family Foundation that has generously supported the work that we've done in California. And I just want to pick up on Chair Albright's question and acknowledge the Children's Data Project in terms of the vital role that they're playing. One of our colleagues refers to the federal picture as the disappearing picture of federal data. So not only are there challenges to researchers around funding and around some of the ways that we analyze data that we collect, but also really vitally important databases like the National Survey of Children's Health, which contains Healthy and Ready to Learn, are no longer producing the kind of information at national level that's so critical. And that's one of the reasons that this commission's interest in and commitment to supporting ongoing data collection in the state of California is so critical, is because some of the resources that we've historically relied upon from federal channels are becoming not only difficult to access, but actually non-existent. I'm going to do a brief overview, and then my colleague, Mr. Khan, and I are going to sort of tag team in terms of the data that we're presenting. But I want to just start by giving you a brief overview of the RAPID survey. RAPID began in the spring of 2020, right at the outset of the pandemic, when we, like many others, were trying to figure out what we could do in the context of our kind of role as researchers to help inform and mitigate some of the challenges in the early childhood sector, because we knew we were headed into a very unknown time in terms of what was going to be going on with children and families. And we designed this survey, and very quickly, with the help of some generous funders, we're able to launch it in a month. Again, fellow researchers will know that no research project ever gets started in a month, but it was an emergency. We got the funding in place, and between March and April, we were able to get the first survey off the ground. The design of the survey was very intentional to provide frequent inputs of information about the well-being of children and adults in the lives of young children, to make it available to advocates, to policymakers, to families themselves, to the early care and education workforce, really as a critical piece of information about how to deal with the challenges that were coming up. The design also required us to have a large sample, and for the data to be not only collected on a very regular basis, but also pushed out collectively. So our surveys by design have had over 1,000 participants, pretty typically very diverse in nature. We use what we call empirical pragmatism as sort of our North Star, which means that we do not necessarily have an epidemiological representative sample in all cases, but we use weighting when we have disproportionate representative sampling in order to get to viable conclusions. And we're always transparent about the limitations of our survey methods. We believe that in the process of gathering this information, bearing witness to the experiences of young children and adults in their lives, that we have huge potential to inform policy. And perhaps nowhere have we gotten more evidence of this than in the fact that we're able to see, as we were tracking nationally, rates of hardship among children and families, that when the child tax credit came into place during the pandemic, we saw dramatic drops in the proportion of families that were reporting that they were experiencing difficulty obtaining basic needs. And when child tax credit and other supports during the pandemic went away, rates of hardship went back up. In our most recent surveys at the end of 2025, we saw that more than half of families in our survey, which again is very diverse and represents the US population, more than half said that in the prior month they couldn't afford at least one basic need. So we're really talking about a situation that is of dire concern. Issues around these questions of affordability that we hear so regularly in the national media and locally are playing out in real time in the lives of the people who are participating in our survey. So let's move to the next slide and keep going. And one more. Okay. So in California, we started in November of 2022 with a goal really to be able to provide data that was as kind of clear and granular in the state of California as we're able to at a national level for our national surveys. The survey is administered by smartphone or a tablet or computer. All you need is a cell signal in order to be able to do it. It's administered via Qualtrics. Takes about 15 minutes for people to complete. We compensate everybody for their participation. You can see that it's available in 8 languages, and that over the last couple of years, we've reached over 15,000 caregivers across the state of California in our data. Next slide. The way that the survey is structured is that we ask both quantitative and open-ended questions, and that balance is really critical because it's helpful to be able to say this proportion of families is reporting this, but it's also really critical to hear family voices. And so we ask questions like, what are the biggest challenges that you've encountered? What would you like your policymakers or elected officials to know? And that structure is sort of this good balance. If you like data, then hopefully you like both quantitative and qualitative data. Rapid tells these stories in kind of both ways. The core content of the survey, every time a survey goes out, we ask about each of these categories. So how kids are doing, how adults are doing. We ask about material hardship, the difficulty in the past month to afford or pay for basic needs. And we ask about access to and conditions of affordability of childcare and access to and utilization of healthcare. Those are the core questions. And then in addition, we add drop-in modules that focus on kind of contemporary issues that are of importance. And so if you go to the next slide, you can see that these are some of the things that we've asked about in our California survey, and we'll be talking about some of them as we get into the data. Some that are particularly, I think, noteworthy have to do with experiences of extreme weather. We have some data that we'll report today about concerns about immigration and immigration enforcement, and about transitional kindergarten access. Next slide. Okay, so I'm going to pass the baton to Abigail, and then we'll go back and forth.
Thank you, commissioners. Thank you, Dr. Fisher. I also want to acknowledge, in addition to the role of First Five California, that we would not be successful in our recruitment across California without First Five commissions and the partnership with First Five Association. So to say that our partnership with First Five has been instrumental is an understatement. Behind these numbers that I'm going to share are parents who honor us with their responses on a monthly basis. These are parents who are struggling and who are resilient. And we want to thank them for taking the time to share their experiences with us. We also know that despite the struggles that you'll see in this data, parents every day set aside those worries to have that beautiful connective moment with their young child. And that resilience is what gives our team strength to keep going and know that the importance of lifting up their voices is critical for policymakers like yourself to hear. We are often asked, what investment would help in educational outcomes if we could make one investment? And I think the findings from Rapid nationally and across the state of California lift up what First Five California has been at the forefront of for a very long time, which is that young children, more than any other age group, are responsive to the environments around them. If their parents are thriving, they have so much more of an opportunity to thrive themselves. If their communities are stable, they too have the ability to be stable and to attain educational success and healthy development. So with that, we'll dive a little bit further into some key findings. As Dr. Fisher said, we are always transparent with our sample. Today, some of our findings will be pulling from different sample sets, and we will make note and are happy to answer further questions about our samples as we go through. This is the general California rapid sample, and it is reflective in many ways of the California population. And as Dr. Fisher noted, we use weighting techniques when it is not, but just to acknowledge that within this, we closely mirror California's Latin population. We overrepresent Black parents, and we are underrepresenting white and Asian parents relative to statewide demographics. Again, we use weighting techniques to work to balance those things out. We are overrepresented in low and middle income families compared with California's overall income distribution. Next slide, please. Across all rapid surveys, as Dr. Fisher was referring to, we have been able to track something that we have coined the term of the material hardship curve. When parents are experiencing high levels of material hardship, we then see that parents' distress increases and that children's distress also increases. We see when material hardship is lower, parents' distress decreases and child distress decreases. This is ripe for policy intervention. In California, we see consistently high levels of parents experiencing material hardship and thus high levels of emotional distress. Next slide, please. Specifically, in September of 2025, 82% of parents in our survey were experiencing material hardship. You will note that is significantly higher than in the national numbers that Dr. Fisher referenced. And middle income households, as defined here, are the most likely to report their experience with material hardship. Next slide, please. Perhaps not unsurprisingly, with that rate of material hardship challenges, 92% of parents surveyed reported experiencing emotional distress, with anxiety being the highest common reported symptom of emotional distress. Next slide, please. As Dr. Fisher noted, we also ask open-ended questions, and I will pause and let this parent from Sacramento County speak for themselves and give you time to take in their words. And I will just note that when we use quotes in this presentation, we select them because they are emblematic of other parents responding in the survey. Thank you to that parent in Sacramento County for sharing their voice with us. Next slide, please. And as we talked about with the material hardship curve, 67% of parents reported their children experiencing emotional distress in September of 2025. And I'll note that that fear number is particularly high in the California survey in September of 2025. Next slide, please. Pass it back to Dr. Fisher to talk about our national sample.
Yeah, let me just bookend what Abigail was saying to note that in terms of the hardship rates that we're seeing and the fact that they're so much higher in California than elsewhere, I expect this does not come as a huge surprise. But really, when we hear about the affordability crisis that's going on, this really plays out in real time in our data. And so I think understanding the connections between that and, as we've said, sort of people's well-being is really critical to understanding the well-being of kids in our community, because until we can make some headway with these issues, we're going to continue to really see parents struggling. I'll say that in our data on hardship, the item that parents most frequently say they're not able to pay for is utilities. That's not just because utility costs have gone up, but it's also because we frequently hear in the open-ended comments that when people have to choose what they're not going to pay for in a given month, utilities is usually the first thing to go. You're not going to skip paying for food. You're not going to skip your rent and risk eviction. If you have healthcare bills, you're going to pay those. You're going to pay for childcare. So utilities goes first because people simply are making hard choices, but those choices in and of themselves have emotional weight and bring emotional weight with them. So I want to zero in a little bit on childcare. We've presented some state data in the past to other groups about what we're seeing with childcare, but just in terms of our national data, I think these are useful numbers. So the next slide, please. And this again is just sort of our transparency in terms of what the national sample looks like. But I want to make sure that we're making good time getting through these slides. So next slide, please. So if you just look at difficulty obtaining care, that is people who in a given month report that they don't have care and are looking for it, fully 15% of families in any given month say that they're in the market for childcare. And among those who are saying that that's the case, a very large number of them, 81%, say that it's impacting their work. When work is impacted, our data consistently show, as do others, that it's typically women who are most affected. Women are the ones who are forced to give up or reduce the amount of time that they're working in order to deal with childcare shortages. And you can see that these issues are not just, and I think this is similar to what Abigail presented, not just among the lowest income families, but actually among low and middle income families. We see these issues, but also kind of not exclusively there, but also among some of our higher income. Next slide, please. We also see that the costs of care are going up. And so in June 2025, about 30% of our families reported that there had been increases in their childcare costs, and that these were largely due to rises in cost of tuition. As I'm sure you all know, the childcare situation in this country has been referred to by former Secretary Janet Yellen of the Treasury as a broken market. Parents can't afford to pay the costs. People who work in early care and education can't afford to live on what they're earning. And so this is a really critical issue that has to be tackled. And again, with the sort of absence of federal attention to these issues, this is falling to states to try to solve these kinds of problems. Next slide, please. Okay, we're passing the baton back to Abigail to talk about transitional kindergarten.
So sitting with really, really difficult data, there are many bright spots in California. And the rollout of California's free transitional kindergarten has many bright spots among it. In our survey, parents see it as a source of support for their families. And I'll just spend a little bit of time on it. And I want to note that we have so much more data and findings available through fact sheets. You can actually sort our website, our rapid survey website, for California-based fact sheets and be able to dig further into all of these findings and ones we aren't presenting. In August of 2025, more than 3 in 4 families in California had heard of TK. And we should not race through that because this is a brand new thing. And so getting information, it's a brand new grade. And these are not kids that are coming from a public system so you can have them all and talk to them. They're coming from really complicated, different home-based mixed delivery systems. So getting the word out is not a small task. And so it's really exciting to see that number ticking up over time. And you'll see this California parent talking about how transitional kindergarten has been a, quote, absolute lifesaver for their family. So we want to really make sure to celebrate those successes. Next slide, please. Here we present a little bit of information, and there's more available in our fact sheets and on our website about the folks who maybe don't know about TK and what can be done to close information gaps. We see in our findings that low-income parents are less likely to know about transitional kindergarten, and they're more likely to have heard about it from a family or friend. That's not in and of itself problematic. Those are trusted messengers about transitional kindergarten, and it shows us an opportunity to work collectively across all sectors to get information out to harder to reach communities. Next slide, please. In our survey, just for frame of reference, 65% of parents surveyed with a TK eligible child are enrolled in transitional kindergarten, and you can see how that breakdown works in our survey across income levels. Next slide, please. And this is really exciting to me. 75% of families say their experiences with transitional kindergarten meet their expectations. I know there's been a tremendous amount of debate in California about transitional kindergarten, but knowing that when parents know about it and they're able to enroll and it meets their family's needs for location and timing and access, that it is a quote no-brainer for this family in Marin is really something to celebrate and to use data to continuously build our successes with transitional kindergarten. And back to Phil to talk about immigration.
Abigail delivers the good news. I actually. So it goes. I do want to say just really quickly that I think one of the things that the TK data show is some of the successes that we're seeing. And I think one of the things about the architecture of Rapid is that it allows us to continue to gather information, to continue to focus on how to get more access and more equitable access. So for example, we also have data that Abigail didn't present that shows that there are demographic differences in terms of how people find out about TK, and that in some of the demographics where there's lower enrollment, the information about TK is typically obtained through family and friends, as opposed to through public information sources. That suggests some opportunities to disseminate information about TK, and kind of what it might allow in ways that are different than we've gone about it, and then to see whether that's making a difference in places where there are differences and equitable differences in it. We are able to track, again, the impacts of things like immigration enforcement and what that's doing in the context of the lives of young children and adults who take care of them. So let's look at some of that data next. Next slide, please. Again, this is more recent data that we began collecting in September through December, so it's a smaller sample. You can see that the distributions are fairly similar to what the overall California Rapid data has shown. Next slide. So this slide is, I think, something that should be concerning to everybody, which is that across all parents, 2/3 were concerned that the immigration enforcement activities could affect their participation in childcare. One of our colleagues at Stanford, Tom D, had access to attendance data in 2 central California districts. Some of his findings were reported in the New York Times. One of the things he found was that when immigration enforcement is happening, it very clearly has an impact on school attendance, K-12, but those effects are particularly pronounced in the earliest grades. So really where we see a kind of pre and post impact of these impacts on children's actually attending educational contexts, I think these should be very clearly causes for concern, and you see this reflected in our data. Next slide. So you can see that as well, that parents are noticing impacts on children, and you can see that there are somewhat demographic differences. So Latinx parents and those of other racial and ethnic groups are among the highest reporting concerns about impacts on children, on their well-being from these kinds of experiences. But I do want to note that the concerns are not specific to those demographics alone, and that again, one of the things that I think is a potential lever for impact is just like the idea of affordability is not just affecting the working poor or lowest income families. These issues around immigration enforcement are affecting the well-being of the population with higher rates in some demographics, but things that we're seeing where there are concerns across the board. Next slide. And you can, I'll just let you look at this slide, but we can see what the impacts are. These are things that we would not want families of young children, the early parent workforce, or children themselves to be experiencing. So almost 2/3 say that they're experiencing their children showing fear, stress, and anxiety. And then a number of other issues being reported consistently when people say that these are having impact. And here you can just read some of the comments of some of our parents around these impacts across the state in different counties.
And our final slide, please. As Phil mentioned, as he began, we also always ask parents what they want their policymakers to know. And we wanted to lift up some exemplar quotes there as we wrap up. Before I read a couple of them, I think when people think about early childhood, they often think about programs, childcare slots, home visiting models. And what we're really trying to solve, and what California parents are telling us very clearly, is that we have an infrastructure and systems problem. That systems that were never designed to work together are fracturing even further in these complicated times, and that children and their parents are being impacted. As I said, First Five has always thought with a systems lens, and California parents are telling us and encouraging us, and in fact requiring us to use continuous data and listen to their voices to double down on that systems form of thinking. So here from Los Angeles County, a parent tells us, I would like policymakers to know we need affordable healthcare, extended daycare options, and clear communication about programs. So again, that idea that things are out there, but systems may not be available for them to access them. And the child care subsidy is extremely beneficial from a parent in Solano County. I'm able to face the day with one less burden on my back due to this benefit. If the subsidy was not in effect, I would not be able to afford both a home and childcare. And with that, we'll wrap up our portion of the presentation. I'm happy to take Commissioner questions.
Thank you so much. Do we have, and I can't see our commissioners, but I see Chair Albright. I see that you have a question.
I do. I'm happy to jump in first. I'm so grateful. Thank you so much, Dr. Fisher and Abigail Stewart-Kahn, whom I've worked very closely with for many, many years. So I'm super grateful for this very interesting and insightful report. The last slide is where I had one question, and it was about in their own words. And I was curious what the question was that solicited that kind of data in terms of were people asked sort of an open-ended question, or were they asked, how do we improve the system? And I'm just curious because it's such a wealth of information from different parts of the state, providing very similar and aligned information.
Yeah, but the open-ended questions are really designed to be tools for advocates and policymakers to really make sense of and hear the voices of adults in the lives of young children. This question was phrased, what would you like your policymakers and elected officials to know about how you and your family are doing? And so that it was very much an open-ended question. And again, a wealth of information provided. I will say, just really briefly, that in addition to furnishing individual quotes that many of our partner organizations who are in advocacy say are really useful in doing things like in the state of Connecticut, getting an affordable child care bill passed. We're also able to use this information because we get such great response rates to the open-ended questions to do text-based modeling, which is just a technique that's become more and more popular for using quantitative techniques to analyze large corpora of text-based data. You can think about all the stuff that's happening on social media right now, and you can feed that into these algorithms. And it's not just sort of a black box like some of the AI platforms are. It's a very controlled way to be able to say, here are 5 top themes that are coming out from all of this text that you're getting. And here's how they're changing over time or vary across demographic groups. So it's actually proven to be a windfall of additional data beyond just the quotes that we're able to furnish. I hope that was a helpful answer to your question.
Yeah, very, very helpful. One other question. As you look over the data over the span of the several years, 3 years that you've been doing it, what's surprising you, if anything?
The prevalence of hardship continues to surprise us. The dramatically escalated rates in the last few months of 2025, where more than half of families were struggling, surprised us. The fact that when we look at, we have a parallel national survey of the early care and education workforce, the rates of hardship among early care and education providers are higher than what we see in families of young children. I frequently say that I find it a pretty preposterous notion that we engage in all of these debates about the quality of care when we're asking people to provide nurturing care to kids when they themselves don't have enough food to eat, or worried about feeding their own families, or using their own money to feed the children in their care. And yet we're having these debates about credentialing and education for the workforce. I don't think those are irrelevant discussions, but we have to make sure basic needs are covered first. So some of those things are pretty remarkable. The bright spots are also remarkable. Consistently on our data, we find that one of the things that most mitigates the extent to which people are experiencing distress as a result of hardship is quality time that they spend with their kids, being able to stick with routines, and even what they get back from their very young children in terms of the kind of emotional support and connections that they feel. Those things consistently, in a statistical way, mediate the relationship between hardship and the distress that we see. And we think those things are really important bright spots to notice. Abigail, what would you add?
So those were great. I'll add, Chair Albright, that I don't think it is surprising to Phil or I, but bears repeating the impact of immigration enforcement policy across the whole population. It's certainly not surprising that it would have impact on targeted groups. And I think it's really important to lift up that it is not only affecting those groups, because I think that is unfortunately how we get coalition and attention on these issues. So not surprising to us personally, but important to reiterate.
Can I add?
Please.
Point of privilege as chair is that when the immigration data was shared, I said, but these aren't immigrant families, these is everybody.
Yeah.
So the non-immigrant families are feeling the impact of immigration enforcement, and we need to be mindful of that.
That's right.
Right. Yeah. So thank you for your work here. I think it really does lift up what we all are trying to kind of moving towards is parent voice. We started with the thank you, Executive Director Makadesian, of what does parent voice look like, funding these things closest to the ground. Thank you again to USC Reagan to kind of, again, how are the children doing, population level, but really what does that voice look like in real time? That will set up the stage later about, talking about our both state and federal priorities. So I think it's the first time we've ever probably had you present. And you presented in different forums, but that is, to me, has always been such a privilege to co-chair with you all. I think they somehow recruited me because we were at Stanford and I said, I love data.
We had our eyes on you.
Oh, did you? Did you? And it was at an AARP event or something, I feel like, so we were just having a conversation about the care economy and how we don't value that as a public policy. So thank you for your notes on that.
Thank you. Any other questions?
Just
Yes,
a
please.
small question related to one of the topics Commissioner Perry brought up at the beginning of the California Health Interview Survey. We have a number of different survey instruments, right? Where you each have a role to play. I'm curious how you decide what questions to ask. That process looks like.
The core questions have been in place for a long time, and they're really just sort of a surround sound view of the kind of issues facing families. A lot of the additional content is suggested by partners that we work with. Because the survey goes out on a monthly basis, we're able to really be thinking about what's on people's radar the most at a particular time. And in particular, when we see advocacy organizations that are really interested in particular issues and have a demand to gather data quickly and get it sort of into their hands so that they can proceed with looking out for the well-being of kids and families, that will often drive the kinds of questions that we're putting in. Another thing that's nice about the frequency is that, as I'm sure all of the data wonks know, sometimes you develop a question if it's not from an existing validated source, and the responses you get make it clear that you need to refine your question. So we're also able to do that over time. So, for example, when we ask about the types of care that people are obtaining for their children, whether it's family, friend, and neighbor, home-based care. It took us a while to kind of get the categories of response correct, but that's pretty much how we go at it.
I'll just add in California, our California Rapid Advisory has been instrumental in thinking about new modules that are relevant to California. For example, we're currently developing an updated set of questions around transitional kindergarten with transitional kindergarten experts from across the state of California, some from our rapid advisory. And the other thing, and time and real life tells us what to ask. We ask about extreme weather in California after the various fire seasons that we've experienced during rapid. And then finally, I think we listen to parents. And so if something is coming from California rapid data that is new or interesting, or we see as a kernel in the open-ended questions through the methodology that Dr. Fisher is talking about, we can sort of zoom in on that and ask additional questions the next month or the month after that.
And just a couple of final comments and questions for me. I really appreciate the insights into TK, and while you share that as a bright spot, I think there is an opportunity for us to think about. But you said 77% of parents know about TK. How do we think about the work that has to happen for those that don't know? And so I'm wondering, we end here with what do policymakers need to know? I think there's also really valuable insights and information here for school districts, right, that are rolling out this new grade in real time. So do you all, does this data go to school districts? And if not, how might First Five and the network think about our relationships with those districts in terms of data sharing?
So in California, particularly around TK, we welcome all opportunities to share at the district level and at the county level. We are in conversation with several counties across California about oversampling, who are particularly interested in having their super localized data from Rapid available to them, sometimes because they're interested in hearing this TK feedback loop straight away. And there's more we would love to do. So anything that the First Five Commission and First Five can do to connect us to district leaders. We do share it as a bright spot because it's new, and we know that that people on the ground and at the state level are really interested in its success. And so this is important feedback loop to build on, to expect the bumps that come, but not to just be complacent with the 77%, to use the information to go further. So anywhere and everywhere we can be sharing this data, we want to be.
And are we able to disaggregate it geographically? And the reason I ask is certain districts have been implementing longer. So I'm on the school board in San Diego without going too far down that path. But we were ahead of other districts in the state. So I'm curious, for those districts that have been implementing TK universally longer than others, do we see higher rates of awareness? Or are there other factors that contribute to whether parents know or don't know about it?
So generally speaking, in California, there are some parts of California that have a high enough response rate sample where we would be comfortable doing some disaggregated analysis. We would welcome that request from San Diego to run those numbers, to take a look at. San Diego is one of the communities that has a higher response rate to our sample. So I think we could furnish your community with some data. And we're working on oversampling, where we want to make sure we're hearing, for example, from rural communities who tend to be less likely to be to be heard in these types of samples. So, so sort of anyone listening, please contact us through our website, and we would love to take a look at our data, see what's there already, and discuss, if we don't have enough folks and parents responding from your community, how we can expand our partnership.
I just want to highlight this because I think it's also a really good example of how all of these things can form a virtuous cycle, in the sense that as we think about implementation of policies and practices, and we think about where data comes in, I think too often data is held up, undoubtedly not by this group, but held up as sort of a binary outcome. Something's working or it isn't. And I think TK is a great example of that, where you have advocates for it, you have people who are skeptical about some of the components of it. Our perspective is that what frequent data does is to provide a feedback loop into the system to allow for kind of systems change calibration, so that what you're learning can be used to make things better. And I think that's a really critical issue, that it's not, we don't want anybody to take a particular data point and say, this is the end of the story. What we want is for this information to be dynamic and coming back into the systems to really influence the thinking that's being done about these things over time. And so hopefully some of these questions, like your request, will be things that we can furnish this information so that it can be used for those purposes. Because that's really, continuous improvement is a much nicer kind of frame than like put it in place and then pull it back out because it didn't work, which it creates all kinds of inefficiencies and entropy in the process.
Yeah, and I think, that's what's particularly exciting, both about, what you're sharing from the rapid survey and what we heard before, how real time it is.
Yes.
Right, that we can actually use that information to inform both policy, which takes a little longer, but actual work on the ground in real time. So I really appreciate that. And also just want to lift up, right, that as we think about things like TK, it's not just about the education, but really overlaps with, some of the results you shared around the affordability.
That's right.
Right. So what we know is that through TK, we're getting universal breakfast and lunch, which for many families equals about $1,800 a year per child in savings. And so I think to think about how all of these things overlap is really important. And then lastly, and we are going to lunch, I promise, are there plans to share these two data sets at the Day of Action and at the summit, and how are we pushing them out?
We're always trying to figure out how to get the rapid survey, and so there's a PR plan that I know that.
And I think
and we can we want to feature them at the summit as well as kind of even before the summit, because it's fall. There's information now that, to your point, should be shared to inform public policy.
And I would say also Day of Action.
And our Day of Action. Yes, of course. Yes, all the things.
Wonderful. Well, thank you all. I think this was a great way to kick off 26 and really reorient ourselves and align ourselves to our strategic plan and our priorities, and really to have access to real-time data to inform the decisions we make moving forward. And just appreciate the conversation. And my hope is that we continue to hear what the data are telling us, because it's not one and done, right? There are always new data to inform our work. So thank you to everyone. And with that, we will take a break for lunch. We were going to take 50 minutes. Oh, sorry. Public comment and then a break for lunch. Public comment. Do we have any, Simon?
We have none in the virtual queue. Anyone in Sacramento? Nope.
Anyone? Any other?
Oh, one question here.
Maybe a public comment.
Please.
And public comment.
Can you see?
I can't see if you can state your name, please.
Yes, Fabiola Gonzalez here in the Fresno Satellite Office with Commissioner Paz. Maybe just one comment that came to mind as we are thinking about the two amazing data sources that were presented on today, and how Rapid Survey is a monthly data that comes out. And I'm thinking of the regions that First Five California has for all of us, and how wonderful could it be that we get this type of data shared to us, with us, per region. This is what the Rapid Survey is showing in terms of these key issues, TK, childcare, et cetera. But I can't imagine how wonderful it would be for all of us if countywide, it would be lovely, but I know that I heard not all the counties, you don't have enough info per county per se, but at least per region, then we could share with our own partners. I'm thinking we have a superintendent of schools, county office of eds, and all of this good info that we could be helpful to, but if it would be much more directive from, or like helpful from First Light California to all of us, so that we could help in turn share that Rapid Survey data. Just the thought that came to mind.
Thank you. So I want to tell you, I'm seeing a nodding head that yes, we can get you that, not I, but that information is available and can be and will be shared with regions. on a monthly basis. If you want, I don't want to overpromise. I just see a nodding head. I don't know what that means.
Yes, the nodding head is enthusiasm because this is what the data is for. And I think if First Five or whatever body wants to furnish us with that request, we can put that against our timelines and are delighted to do that work and provide it back. That is what Rapid California is designed for.
Bravo.
In real time.
Yes. Well, thank you. And I didn't mean to interrupt, but just wanted you to know, yes, it's coming. Anything else?
No, thank you so much.
Yes. Okay. Any other public comment in any of our locations?
I think Commissioner Paz has a question.
Please.
No, I don't have a question. I wanted to make sure Fabiola was heard. But great, I think it's going to be a great resource, and I love the sharing of the information, and I think it could be very persuasive to policymakers as well. So I think it's going to be a really good tool moving forward, especially during election season.
Wonderful. And I just want to remind everyone, all of our counties have access to this deck with this data that is very recent. And so hopefully you'll use that now before we get those monthly updates out. So we will now take a break for lunch. Again, we were planning for 15 minutes. My recommendation is that we do 30 minutes and come back at 1:40. Does that work for everyone, commissioners? Okay, so we will come back at 1:40. Thank you. Yeah. Hope everyone had a nice little break, and we are now back at it, and we're gonna get started with item 8, which is a financial update. This is an information item only. I'd like to invite Commissioner Jimenez to provide an update on the Fiscal and Audits Advisory Committee, and Deputy Director of Administration, Raylina Ruiz, to present the financial update on behalf of Marcia Thomas, Director of the Fiscal Services Office, who's unable to join us today.
Wonderful. Well, thank you. So at our January 16th Fiscal and Audit Advisory Committee, we met and discussed the following 4 items. Upon the release of the governor's proposed budget on January 10th, our state commission received updated point-in-time revenue projections with sufficient time to share during our Fiscal and Audit Advisory Committee meeting. The revenue projections, as expected, continue to show a downward trend, which staff today will present to the commissioners and the public in the financial update. The second topic we talked about was our First Five California draft annual budget. As you recall, we continue to work with staff on the display of the annual budget, including improvements at each quarter to allow for easier viewing. To address the request for investment details, we've added columns to the annual budget display, such as the total amount of the investment, the years of the approved investment, and overall investment percentages. And hopefully this will help to display what our annual budget is for both the commission and the public. Thirdly, we reviewed the annual audit oversight that was completed of the county commissions that was received by the state controller's office back in December, and staff will touch upon it today. The good thing is that the state controller's office did not recommend withholding funding allocations from any of our 58 counties. And then lastly, we discussed the process for utilizing fund accounts for commission funding proposals, primarily when the unallocated fund account is utilized to fund a proposal. As you might recall, 2% is deposited into the unallocated account for expenditure by the state commission for any purpose of the act. For example, historically, the commission has used the unallocated fund to support investments in child health, since there is not a dedicated fund for this important issue. And in addition, and if an account does not have sufficient fiscal health to cover a multi-year commitment that the commission has voted on, staff may propose using unallocated to fund the proposal rather than reducing the overall funding amount of that project. And so this is just a high-level summary of what our committee discussion was, and now I'll hand it over to Raylina.
Thank you, Commissioner Jimenez. Good afternoon, Chair and Commissioners. Today, I'll be walking you through the financial update to give you an overview of our fiscal outlook. I'll try to talk as loud as I can. Next slide, please. The California Department of Tax and Fee Administration collects the top 10 revenues on cigarette and tobacco products. And prior to transferring the money to the designated fund accounts based off statutory allocation percentages, CDTFA deducts administrative costs, the backfill to Proposition 99 and Breast Cancer Fund, and statewide assessments such as Paretta. The costs are not static and vary each fiscal year, and this slide shows a 5-year history of those deductions. Next slide. Our statutory distribution under Health and Safety Code 13105 allocates revenue from the California Children and Families Trust Fund as follows: 80% to county commissions, 20% to the state commission across 6 state administered fund accounts as follows: 6% to media, 5% to education, 3% to childcare, 3% to research and development, 2% to unallocated, and 1% for administration. Next slide. So this slide shows actual fiscal year 24-25 revenue and projections for the next 5 fiscal years. Projected revenues are based on point-in-time revenue projections and estimated deductions. These projections are not static and will fluctuate based on varying factors. Some examples could be economic conditions, consumption changes, or changes in state and federal policies, such as the flavor ban. The implementation of the flavor ban accelerated the decline in Proposition 10 revenues, and on January 1st, 2026, California Assembly Bill 3218 went into effect, which furthers enforcement of the flavor ban. The full impact of the flavor ban on revenues is still uncertain. These numbers were updated after the release of the governor's budget earlier this month. Next slide. We have 3 main revenue sources that we received throughout the fiscal year. For 24-25, the State Commission received approximately $53.9 million in total revenue. The State Commission receives the transfer of revenues monthly for Proposition 10, which is shown in blue, and Proposition 56 backfill is shown in orange and received annually. That usually transfers at the beginning of the calendar year between January to March. And the California Electronic Cigarette Excise Tax, or CSET, is transferred quarterly and shown in green. As mentioned previously, the California Children and Families Trust Fund earns interest, and that is shown as SMIF in yellow at the end of those bars. And it's allocated to the fund accounts based on the percentages defined in statute. Next slide. This slide shows the volatility of month-to-month Proposition 10 revenues that are transferred by CDTFA and could be attributed to several factors, such as the consistent decline in revenues, distributors not needing to purchase additional cigarette stamps, or when holidays fall at the end of the month, it creates a timing issue, being that tax returns and reports are due to CDTFA towards the end of the month. The timing of the holiday does allow sufficient time to receive, reconcile, and remit revenues to the state controller's office in time to be captured in the revenue transfer. For example, in November, the amount we received was $5.4 million, and then you can see in December, that revenue came in higher at $23.9 million. So generally the month that follows will be a little bit higher there. As you saw, okay, so in the previous, as you saw in the previous slide, the majority of our revenue is the monthly Proposition 10 revenue transfer. Can you go back? Sorry, there, yeah. Due to the unpredictable nature of what the incoming revenue transfer will be, it's especially important we have a sufficient fund balance to cover current and future year obligations. The State Commission is continuously appropriated, meaning funds in the accounts at year end are starting balances for the next fiscal year. As we spend down fund balance, we become more reliant on monthly Proposition 10 revenues to meet our obligations. Next slide. So this is the information on SMIF, the Surplus Money Investment Fund, and this slide captures the interest earned in our California Children and Families Trust Fund, and interest is earned based on yield rates that can be found on the State Controller Office's website. The amount earned is allocated at 80% to county commissions and 20% to the state fund accounts. Next slide. When preparing our revenue projections, we utilize point-in-time projections provided by finance during the May revise and governor's budget processes, and estimate reoccurring deductions to the trust fund. So various factors impact the revenue projections. What is projected here may change in May. However, as of today, this is our best forecast. Next slide. So this is our projected revenue versus expenditures. The amounts are taken from our fund condition summary, which is also included in the documents. You will notice we are using available fund balance or carryover balances in the current fiscal year and next fiscal year. Expenditures are closer to our revenues in fiscal year 27-28 because our bigger investments will have sunset the previous year. There are placeholders currently in 28-29 and 29-30 for reoccurring investments, but nothing has been brought to the commission for approval for those fiscal years. We'll have a budget study session in the summer where we'll review current investments as well as future proposals. Next slide. And this is our current budget format. We continue to work with the Fiscal and Audit Advisory on the display of our annual budget. Following our advisory meeting, the 3 additional columns have been added to this display to reflect total investment information. The first column is the total investment, which is the total amount approved by the commission. The second column is the approved number of years for the investment. And the last column added was the overall investment percentage, which includes amounts contracted or encumbered, not necessarily expended at this moment. So additionally, we've updated the revenues to reflect the most recent point-in-time projections received upon release of the governor's budget. You'll notice the Fatherhood Initiative is in blue. That is a placeholder on our financial plan and as mentioned, has not been yet approved by the commission, but it's included in our budget for the start of the year, and we'll continue to update this budget document and monitor its progress as the year continues. Next slide. This is the rest of that document. Because it's so large, we split it into 2 slides. The actuals are up to December 31st, and program actuals are capturing Q1 invoices. Q2 invoices are due this month and will be reflected in the actuals column next quarter. We foresee this being a helpful tool for staff and commissioners in future decision making. Next slide. So the State Controller's Office has oversight responsibility for audits of the first 5 county commissions. In December 2025, we received their 23-24 annual report, and the report showed 79% of independent auditors complied with the audit guide requirements and/or audit standards, which is quite an increase from previous years. And more than half of the counties submitted their reports by the deadline. A copy of the SCO annual report can be found on our website. Next slide. And as an update, on May 23rd, 2024, the State Commission presented information item number 8, informing commissioners that Glenn County did not meet the state requirements for fiscal year 22-23. We're pleased to inform the commission of Glenn's perseverance in bringing the county back into compliance with state requirements. And the county worked diligently with the State Commission as well as the State Controller's Office to submit required documents for the annual audit and the report and the SPCFA program. And as a result, in September 2025, we released the Prop 10 funds that were previously withheld. And with that, I'm happy to take any questions.
Thank you so much. Do we have any questions from commissioners in the room? Any commissioners that would like to ask any questions? Seeing none, we'll move to public comment. Simon, do we have any?
No one in the virtual queue.
Okay, and is there any public?
We have one now.
I'm hearing we have one in the virtual queue.
Stop it.
That's okay.
Okay.
And then the satellite.
Carla Kohler.
Hi, this is Carla Kohler. I'm wondering if you can shed any light on when the Fatherhood Initiative funds are expected to be allocated, and when that happens, will that come down through to the counties through contracts with First Five California?
Is that your entire comment?
Yes.
Okay, and I don't know that it's not our practice to respond, but we really appreciate the feedback from you and of course from all members of the public. Is there any other public comment?
No.
Okay, and is there anyone joining us remotely that has public comment? All right. Thank you very much. It was a great presentation. I'm really excited to see a budget and comparing budget to actual. I think it makes our work as commissioners much easier and to be able to really fulfill our fiduciary responsibility. So thank you to the committee and to the team for making that happen. That's great progress. Moving on to item 9, which is our state and federal budget and legislative update. I am going to ask the team if we were aiming for an hour for this item, but if we can go down to 50 minutes and still aim to end at 2:45. I'd like to invite back both Commissioner Paz to provide an update on the Public Policy Advisory Committee and Jorge de la Cruz, Director of External and Governmental Affairs. Joining them are John Benton and Jonathan Munoz from California Strategies and Leticia Mederos from Actum to present the state and federal legislative update. Commissioner Paz?
Yes, thank you. So our committee met on January 12th and received comprehensive updates on First Five California's legislative priorities, government relations activity, community engagement efforts, and the 2026 governor's state budget proposal and federal policy developments. I'll give a few highlights. The committee received an overview of First Five California's legislative and policy agenda, which aligns with our mission, strategic plan, and audacious goals. We discussed how the agenda guides First Five advocacy by strengthening stable, nurturing relationships and environments through trauma-informed, healing-centered policies that prevent and address toxic stress and support healthy early development, advancing universal childcare by promoting affordable childcare as an essential economic infrastructure, increasing public investment, supporting universal access, and strengthening a mixed delivery system for families, protecting vulnerable families, including immigrant and mixed status families, by addressing fear, misinformation, barriers to services, and by supporting trusted community-led programs that ensure families are safe, supported, and informed, supporting maternal, prenatal, and early childhood care by ensuring equitable access to comprehensive services that promote prevention, early intervention, and healthy development for children birth to age 5. We received an update from staff on government relations efforts with organizations like Children Now and Assemblymember Jackson. The staff highlighted coordinated efforts with First Five Association and county First Five commissions to align legislative priorities across the state. We talked about community engagement efforts, remaining focused, and elevated trusted messengers, parent voices, and frontline provider insights. We reviewed the governor's proposed 2026-2027 budget totaling $348 billion, including $248.3 billion in general fund resources with approximately $23 billion in reserves. Staff explained significant difference between the Department of Finance's projected $2.9 billion deficit and and the legislative office projection of a roughly $18 billion deficit, noting that the May reserves will clarify that. The federal update was also provided, focused on federal threats to childcare, family funding, including freezing approximately $10 billion in childcare, family assistance funding affecting California and other states. The committee was also informed of the potential repeal on the Biden childcare rule, which was designed to reduce family childcare costs and improve provider payment rates. First Five's role in leading bipartisan federal outreach, coordinating with national partners, and sharing on-the-ground impacts to inform advocacy efforts. The committee emphasized the importance of continuing to document real-world impacts, elevate accurate information, and collaborate with federal and national partners to protect children and families. And continued advocacy, both at state and federal levels, remain essential to protecting California's youngest children and families. With that, I'd like to turn it over to Jorge for his presentation.
Thank you. Thank you, Commissioner. And I also want to thank and invite up with me John and Jonathan from California Strategies, as mentioned earlier. And joining us remotely from the East Coast is Leticia with Actum. Thank you, Leticia, in advance. So due to time, I'm going to make sure that we get through the presentation, and my focus will be mostly on state budget and on federal updates. So I'm going to briefly mention the other items. So we have, so as we enter 2026, we remain committed to advancing policies that support the health, well-being, and development of all California's youngest children. And our legislative agenda is, as you all know, available for review, and well, not review, for you to view on the web page for the commission. But generally, our agenda in 2026 will allow us to focus on strengthening safe, stable, and nurturing relationships and environments through trauma-informed, healing-centered policies that prevent and address toxic stress and support healthy early development, advancing universal childcare by promoting affordable childcare as essential economic infrastructure, increasing public investments, supporting universal access, and strengthening a mixed delivery system for families with children birth to age 5. Additionally, it allows us to protect, continue protecting vulnerable families, including immigrant and mixed status families, by addressing fear, misinformation, barriers to services, and supporting trusted community-led programs that ensure families are safe, supported, and informed. And lastly, generally, supporting the maternal, prenatal, and early childhood health by ensuring equitable access to comprehensive services that promote prevention, early intervention, and healthy development for children birth through age 5. And I say general because, again, more details on our policy agenda that's available online. Regarding legislation, so far, as background for the commissioners and everyone present, this year, 2026, is the second year of the 2025-2026 biennial legislative session. That means that we are still seeing bills from last year. So bills may have significant amendments based on negotiations from the first year, and introduce legislation and budget proposals impacting children ages 0 to 5 and their families are being tracked and monitored as we speak. So by the next commission meeting, we should have a more an outlined list of the bills that we are going to either support or looking at, or if we have to find ways of suggesting changes, then we can present that as well next commission meeting. Regarding government relations, just quickly, policymaker meetings are being planned and will begin as the legislative session progresses. This does not even include the meetings that we've already had with some of the members, like Dr. Jackson, just to see where childcare should be and as a priority for lawmakers. Also, coordination with the First Five Association and California and County First Five Commissions is ongoing to advance and align our shared legislative priorities. We just had our first meeting actually last week. I can't remember, schedules and everyone getting back on board for January, but just kind of picking up those regular meetings again to align ourselves. And then coalition partners are being engaged to align advocacy strategy ahead of key budget and policy milestones. Lots of meetings, lots of meetings. Legislative champions and priority committees are being identified to guide targeted outreach. Some of these include, of course, the Women's Caucus, the Select Committee on Child Care Affordability, California Latino Legislative Caucus, and California Legislative Black Caucus, just to name a few. And opportunities like legislative briefings, site visits, and district level engagement are also being identified. A quick update on community engagement. We continue to share trusted messenger insights with legislative staff and administration partners. I love the fact that you are all in agreement that data and information is a tool that we can use with our lawmakers, because that's exactly what we will be continuing and increasing on this year, this 2026. Shout outs to Yana on that. Our team continues to participate in coalition-led advocacy, including convenings, webinars, and advocacy days that mobilize stakeholders around budget priorities and early childhood investments. And of course, statewide partnerships continue to be our primary focus. We aim to have regular engagement with county First Five commissions, advocacy coalitions, and community-based organizations to elevate local priorities and inform statewide policy strategy. This is just a quick example of what we've done since the last commission meeting. We had a legislative briefing on Children First at the Capitol. Lawmakers and their staff, staffers, and other organizations came to learn about Children First, since they heard about it from the commission meeting. And now I'm gonna go ahead and talk briefly on state budget update. We're just gonna talk about this, and for this section, I'm gonna invite my colleagues from California Strategies to speak a little bit more on the state budget update. John, I'll go ahead and give you the clicker.
That's dangerous.
John squared. John and Jonathan squared.
That's right. Thanks. And I think last time I was here, it was upstairs, you know, in your old meeting room. John Benton with California Strategies, my colleague Jonathan Munoz, and then Monique Ramos, who's another colleague that works on First Five issues, First Five California issues. She manages the Early Care and Education Coalition, ECE Coalition, which we started back in 2013, and which First Five California has funded over the years. So we certainly appreciate that. Very effective coalition. Also wanted to say hello and recognize my longtime First Five friends in the audience here. So it's good to see them. In terms of the budget, you heard the numbers earlier. So those are the basic numbers up there in terms of the budget. I won't go over those again. These are kind of the 5 takeaways from the governor's budget that we wanted to leave you with. First off, this is a placeholder budget. The real action will not come until May revise. The governor's budget is, from an optics standpoint, balanced, but they did not take into consideration anything around HR 1 impacts, our Medi-Cal program or our CalFresh program. Didn't really include anything around the MCO tax and the potential loss of that. The hospital directed payments that support the Medi-Cal program, they didn't really say anything about that. So they acknowledged in their presentation that this was largely a placeholder budget, and they're going to work with the legislature to design cuts and fixes coming up into the May revise. The Department of Finance, the second major takeaway is the Department of Finance and LAO are $15 billion apart. The key differences there are that they're $30 billion apart on the personal income tax that they project to come in over the 3 budget cycles. So think 2024 to 2027 is their 3 budget cycles. They are also, the LAO is less optimistic about the AI bubble and how long that is going to be around and support programs. Also, there's differences over spending. The state spends more than it takes in. And that's kind of moves to the next bullet point, which is that this is the 4th straight budget where we've had significant hole in our budget. In other words, we spend more than we take in. The LAO and the Department of Finance both agree on that there's 3 more years of significant deficits between 25 billion
and $35 billion. And so the LAO says that this budget is precariously balanced and that the legislature needs to get serious about finding solutions to close this consistent structural deficit in the budget. And what that means for First Light California is there's going to be discussions and review of programs to see if they're effective, to see if they are doing what they're supposed to be doing, and to see if they may need to cut some funding from that. And so the May revise is going to be really important. The legislature and their budget committees have also asked the Department of Finance to come and the administration to come to them earlier than they normally do. Normally for the May revise, a lot of ideas drop a couple of weeks before the May revise, and there's not any time to vet them and really have a discussion. This year is different. The Department of Finance and even Director Voss at the Department of Healthcare Services says they're going to come early and often to the legislature to have discussions around how to deal with HR 1 and how to cut some of the funding moving forward and deal with the structural deficit. So we'll be engaged with that early on. In terms of HR 1's true impact, as I said earlier, those were not addressed in the budget. But moving forward, I don't know if you recall that the Health and Human Services Secretary, Kim Johnson, estimated $30 billion impacting annually to California from HR 1. I think they've since revised that estimate downward, but they are still projecting tens of billions of dollars of potential loss of federal funding under Medi-Cal, under CalFresh, and other programs that you care about. And so we will, they were going to be developing some plans. Director Voss said that in committee, Senate Budget Committee the other day, last week, that she's going to be developing plans for how to deal with HR 1. I think you can anticipate cuts. They've already talked about what to do with the governor's budget creates a program for the expanded unsatisfactory immigration status, the UIS population, which now includes refugees, people escaping human trafficking. Others that used to be covered by Medi-Cal under HR 1 are no longer. And so what's that program looking like? And so I think from an advocacy standpoint, we have the opportunity to impress upon them the need for certainly pregnancy services.
Megan, I think that is all printed.
Okay. And then the other thing that's a major discussion that we will probably engage in or like to engage in is that we're going to have to return to kind of a patchwork healthcare system, the county indigent health programs, the clinics, the hospitals, all that with the ACA expansion, that moved over to Medi-Cal. And so in a number of counties across California, those programs have dissolved or they're just not working at the same capacity they did before. So the counties will have a huge stake now, not only on eligibility for the new eligibility requirements for Medi-Cal and CalFresh, but also for the indigent population, folks that were on Medi-Cal that are now going to be likely receiving their care in the hospital emergency rooms. And so that is going to be a major discussion that First Light California should be engaged in moving forward. And I'll turn the rest over to my colleague.
Thank you, John. Good afternoon, commissioners. I'll just briefly go over Prop 98. This year, the purposeful spending for just as a reminder too, under California law, K through 14 schools get roughly 40% of the state's budget. TK, yes, TK now, fully funded TK. So purposeful spending this year is coming out to $27,000, which is the highest it's ever been. I believe general fund of that is roughly 20 to 23,000. So most of the bulk is coming from our general fund. Like I mentioned, TK is now fully funded, fully implemented, which is a great success. Has been years in the making. As well as an additional $1 billion for community schools, and that is for existing and then digital community co-funding moving forward. We now have fully funded universal school meals, which is another great accomplishment that the governor pushed forward. Childcare is being funded at $7.5 billion roughly, serving 487,000 children. In accordance with the budget agreement from 21-22, This budget is adhering to funding 146,000 new childcare slots, which for South California was supported in the past and is supportive. All nutritional school programs are receiving a 2.41 COLA adjustment, which is great news. And then included in this budget increase of $11.5 million for childcare infrastructure. This mainly has to do with the childcare facilities that were affected by the fires in Los Angeles last year. And then lastly, before I move back to Jorge, as John mentioned earlier, First Time California is a proud partner of the ECE Coalition. And some of the parties moving into the 26-27 budget negotiations are including funding 44,000 slots to keep up with that agreement from 21-22. Obviously, we continue to push for rate reform to make sure that our providers are getting paid adequately across the board. And then there's the ECE reversion account is also a priority this year. And I believe that's.
And I think before we move on to the federal update, if we can take questions about the state update while it's fresh in our minds. So do any commissioners have any questions about state policy work or the budget or what's happening on that front?
I think there are lots of terminology that we're all familiar with. Jonathan, you said ECE reversion. I think I'm sure that some folks are curious about what that is. Which is on the other side.
So Monique is not here.
Uh-huh.
So, anybody else in the audience know what the reversion account? Okay, I'm assuming it's money left over from last year and they want to be able to move it forward to this year, but I will get clarification from that from Monique.
Okay. Just an opportunity, an area of opportunity that every year there are unspent ECE dollars, whether that be CSVP or anything else. The question is, it often gets reverted to the general fund and redistributed versus held in the same program. So.
Thank you. Chair Albright.
Thanks so much. I really appreciate this report, and I was able to hear it in the policy committee as well. I have a question in terms of the HR1 and its impact in Medi-Cal. You talked about where we're going to see what is going to unfold. Could you spend a little bit more time talking about what the impact may be in different communities, rural communities versus urban, north, south, that kind of thing, just so we get a little bit more of a sense of where the concern is, in addition to overall, but just sort of a more nuanced analysis?
Yeah, roughly 2 million, I think 2 million lives or enrollees are coming off of the either both Medi-Cal and Covered California. So 2 million likely uninsured unless they are able to afford coverage somewhere else. The counties are going to have to rebuild their indigent care systems. They're all over the board in terms, some of them have just basic services. Some of them have more comprehensive services. In San Francisco, for example, Healthy San Francisco taxed their businesses to support their indigent program, Healthy San Francisco, before the ACA expansion. I think it all depends on the counties. I was just actually reading a report from 2025 from the California Healthcare Foundation on the numbers of folks who were part of the ACA expansion that are now going to be uninsured, and it's all over the place. I think there's 2 million in Los Angeles. I think there's 230 some odd thousand here in Sacramento, 450,000 down in San Diego County. So it's all over the board, and I can certainly share that report with Jackie so she can get that to you. I think that the biggest issue for right now for Department of Healthcare Services and Department of Social Services is they have to fix their systems. California has been above, part of HR1 was if you have systems that are making mistakes in payments or enrollment for CalFresh, then you're going to get penalized if it's over a certain percentage. And I can't recall a percentage right now. So they've got money in this year's budget to fix those systems quickly so they can avoid withholds or penalties from the federal government on monies coming down to California for payment for system error ratios that have been high for California. So that's another issue that they're dealing with. I think Jonathan's mother is in King County, does eligibility for the county. And talking about the amount of overtime down in King County right now. In the hearing last week on the Assembly Health Committee that Assembly Member Chair Bonta had, the County Welfare Directors Association director said that, it takes 6 months to hire maybe. It takes another 3 months to train. They're on probation for 3 months. They're not going to be able to tomorrow to hit a magic wand and hire 50 people to do all this eligibility issues. And so the departments are trying to use technology. They're trying to connect data systems with workforce data, because if you want to track the employment data of someone under HR1, if you want to track, are they in community college right now, which allows them to be exempted, or if they're in CSU or community, they're exempted. Other conditions allow them to be exempted. They're trying to tack into all of these data systems to be able to make it easier on counties. But nonetheless, counties are still going to be struggling with this just to implement. And so I don't know if that answered your question or not.
I see a nodding
Yeah,
head.
thank you. I'd like the report. That's helpful.
Thank you. Any other questions from commissioners? I've got just a quick one, which is, I know yesterday there was an Assembly Budget Oversight Committee hearing on the administration's threat to freeze childcare funding. Were we there? Did we participate?
Yes, Commissioner, I was there on behalf of First Light California to express our support to the administration and Attorney General Bonta for taking swift action to protect those dollars and to continue to work with the legislature to continue to see what we can do to mitigate those kind of impacts.
And Monique was there speaking on behalf of the ECE coalition, and so that's why we have two people there, so you could have a separate voice. And then additionally, I met with Bonta's chief of staff just to continue the conversation about how we can continue supporting the voices of children 0 to 5 in these conversations, because that way it's across the board health, but then what does that mean for kids? Which I think is what we were discussing. So more to come. That answer your question?
Yeah.
Okay.
Okay, those were all the.
I think it's also important to highlight that former Senator Holly Mitchell, who's now chair of the First Five LA, was asked to testify and actually really kind of honed in on really the infrastructure that California has built and shoring that up, so to ensure that all families receive the care that they need and deserve, right, for the economy. So just wanted to kind of give a little bit of a plug to First Light LA and former Senator Holly Mitchell in that moment.
That's terrific. Thank you. Should we go to federal update?
Yeah, for sure. And before jumping on and introducing Letty, I know that there's questions over HR1, and Letty's definitely going to dive a little bit deeper into that from a federal standpoint, in her report. And but I do want to remind Commissioner and everyone present, this budget is going to change. It's going to change. So, with that said, Letty, I want to go ahead and pass it over to you. I'm more than happy to be your clicker. So
okay. Thank you. Thanks so much for the opportunity to talk with you. And we did it, maybe in the micro to macro level now as to I want to talk to you about the impacts of HR1 from the federal perspective, what it means to California, and then what we'll be working on in 2026 as we start this year. As many of you know, HR1 is a sea change in federal policy, cannot be overstated enough. It's going to cut about almost $800 billion from Medicaid, 268 from the Affordable Care Act, huge numbers in the food stamp program, 200 billion from SNAP. Across the country, it's projected to take out from insurance rolls almost 11 million people. And of course, as we have seen, it increased also the funding for actions on immigration. And I think we're beginning to see the words immigration enforcement are not probably the best at this moment, that don't really capture how that funding is being used. It's beyond that. And the Homeland Security Department in its form of ICE has about $75 billion We're fighting over the annual bill, but in essence, they have billions of dollars to do what they're doing in different cities in California and Minneapolis. Now they'll start in Boston again next week, I've heard. So HR 1 does a lot of things that impact people's daily lives. We are not discussing here, but I urge you to read up on it, or maybe you know. The other side of the ledger is it provides unbelievable tax cuts and tax breaks to corporations and people that are doing very, very well. For California, and I think the state folks have a better hold on it, but I got these numbers from the Congressional Research Service. The health coverage and food assistance cuts shift a larger share of administrative and benefit costs to states. That's going to have a huge impact on your budget, on your next budget. HR 1 is expected to cut $30 billion a year in federal funding from Medi-Cal, and we can see up to 3.4 million California state residents lose coverage of healthcare and Medi-Cal. On food stamps, it will be a very similar impact. California being such a large state, it's going to be devastating to needy families. Jorge, next slide. In terms of the ongoing administration actions, California and especially First Five has been key in providing leadership, talking about the impact of these administrative actions that we've seen. Going back to last year at this time, we were dealing with a freezing of funding. We just saw that again on ACF, TANF, and Social Services Block Grant. As your federal rep, the first thing I did was talk to Jackie and Jorge about the impact of these cuts, and the California delegation immediately did communication to the agency. I can say that with all these things that we've seen in the past 12 months, pressure from the bottom up really does help. We think that we're powerless, but recently, especially when there's like a loud voice and loud action from all across, including the state of California, it really does help to push back. 2 weeks ago, we saw an administrative action to cut very expansively funds for mental health, and within 48 hours, they took that back. So even in the midst of so much unpredictability, we have seen that coordinated efforts really do help. And you guys are in the target zone. We need all the stories and all the data possible to tell the story to your congressional delegation of how it impacts people. And in 2026, Jorge, next slide, we're going to be using the information to do as we have done in the past several years, equip members of the delegation with reports, data, compelling testimonies to effectively advocate for the needs of children and families. When you visit members of Congress, the first thing they ask for is stories. Tell me on the ground how this is impacting people. And we have done that, during the push against HR 1, which was massive, I will say. The advocacy was definitely there. The theory of change was that Republicans in the majority were going to feel the pressure, and we were going to maybe not vote for the bill. And that theory of change was wrong. They were operating from a different perspective. They were operating maybe from a fear factor of this current White House, their own dynamic with the president. But really, it was not for not trying. The advocacy was vast. First Five, we went to the Hill and we took information across the whole delegation to Democrats and Republicans. We sat with Congressman Valadao, with Calvert, with Kiley, with Jacobs, and the works. And we had every information about how many people were going to lose Medicaid in their districts. It was specific and it was great. And we're going to continue doing that this coming year because we have to maintain those relationships. So the foundation is there, and we have to continue doing that work because very smartly, HR 1 comes into effect, prospectively in 2027 for the most part. Beyond that, we have established really strong relationships with coalitions. There's a new network called Prenatal to 5 Policy Network, where Jorge came and provided testimony on how HR 1 was going to affect California. We'll continue to do that. We collaborate with California organizations like the EC Coalition, and we'll keep the First Five Network informed on key federal developments. So we look forward to 26 in the sense that we expect things to change in November. We also working on home visiting with the Home Visiting Coalition because in 2027, the home visiting program is up for reauthorization in California, and First Five played a very big role in the last reauthorization. And this year is sort of a build time for next year. As I was saying, we do expect a change in leadership in the House from the current majority, potentially also in the Senate, unless the administration action is outside the norm to impact the November elections. But all the numbers show that there should be a change in the majority. And the House majority right now will be down to 1 vote probably after Sunday. So anything is possible this year. But I can tell you that we will be very much in touch with your congressional delegation on a constant basis.
Thank you, Letty. And, just continuing those conversations with the California delegation is going to be key because First Five California, we're one of the few state organizations that can advocate, or speak on behalf of a population, but we're the only state agency for children 0 to 5 for the state. So it's our job, and it has been very helpful for us to speak with the delegation to provide them the data that they need to advocate accordingly, right? So one of the questions, I forgot from where, but it was like, what exactly what agency like First Five California or commission like First Five California do at the federal level? And it's exactly that, informing the lawmakers in DC of everything happening in the state. That's why that's the connection between state and federal advocacy connect, because from what we hear all the way from the county level up at the state level, we funnel all of that to DC, provide stories of what's happening to parents, and we're seeing, like Letty mentioned, the results of that advocacy truly in action. Again, and I always tend to speak.
And Jorge, if I can interrupt you a second, we were talking about HR 1, but an untold story that we're about to close hopefully soon is the appropriations process through last year and coming into this year. We actually got increases on CCDBG and Head Start, and other preschool development grants were not eliminated, and other programs were not eliminated. I believe from CCDBG, California gets close to $1 billion or above $1 billion, and you're going to get the same if it all comes through. If we can finish and land the plane next week on this appropriations process, you'll be able to get a good amount of funding. In essence, the Republican Congress said no to the Trump budget of last year. And we had the shutdown. We were in touch. I was in touch with First Five almost every day on the dynamic of that 43-day shutdown. And the appropriators got together. They moved to the Senate on their bipartisan numbers. And if we can land the plane on these 5 bills and separate Homeland Security bill, and the Senate will vote on it tonight or tomorrow, goes back to the House early next week, we will have a pretty normal bill in labor HHS appropriations that funds National Institutes of Health, funds CDC, funds vaccine programs that are trying to eliminate, but the bill funds these programs, funds Department of Education. So an untold story is that the Congress did say no, and that will be a kind of helpful for the coming year. The new budget will come out February 27, or so, around the State of the Union, which is the 24th, and we'll start the process again. But First Five has played a role in that on a constant basis, and has played a very big role in servicing the members of Congress with information for the daily or annual, monthly appropriations process. And that's not in the stuff we wrote in, but that really occupies a lot of the time at the federal level.
Any questions from commissioners?
Yes, please. So I was just wondering, you talk about a lot about the California partners, but do you want to be making partners with multi-state organizations or coalitions?
Absolutely, like Letty mentioned, and Letty, feel free to jump in here if need be, but an organization that we're we actually got to present to, because of the relationship that we built, is the Prenatal to Five organization, the home visiting organization coalition, and just to name a few, childcare aware,
Yes,
Macy.
yes. Yeah, when Jackie, when she came to, when Jackie came to DC in the spring, we always make an effort of meeting with national leaders, the National Women's Law Center, Center for Law and Social Policy, 0 to 3. And Jorge keeps mentioning Prenatal to 5, because I do want to tell you, this is an organization that's just started by 0 to 3 in the past year that has over 35 children's groups. And it's not advocating on childcare specifically or on mental health specifically. It's operating on setting up an agenda for the whole child, and it's starting to forge that agenda. And we're hopeful that they're going to incorporate some state groups. And First Five has the lead on that when they open up for new members.
Thank you. Any other questions or items to discuss from commissioners on our federal policy work? Okay, we'll move to public comment then. Do we have any public comment? Looks like we have one person in the room. Welcome back.
Thank you. Thank you, Vice Chair. Hazen, are you taking public comment on the whole item?
Yes.
Right now? Okay, great. Abo McDesson, representing the First Five Association of California. On this item, I wanted to just mention that the First Five California Commission's policy agenda and the First Five Association's policy agenda, which was approved late last year, are very much aligned on almost everything, including childcare, trauma-informed systems, maternal health, vulnerable families. However, there is one critical difference that I wanted to point out, is that the association's policy agenda, in addition to supporting families, providers, and children, also explicitly calls out the support of the First Five network and the First Five infrastructure. And that is an item that was in the policy agenda last year for First Five California. We don't see it in the policy agenda this year for First Five California. And just wanted to know why. We certainly believe that the First Five network is the weaver, the infrastructure of the early childhood system in California. And early childhood systems depend on the First Five system. And we all think that it should be a viable and thriving system in order for us to be able to do all the policy advocacy work and implementation that we and our families need. Thank you.
Thank you very much. Appreciate that feedback. Do we have any other public comments?
Fresno, I believe we have a public comment.
Thank you. Fresno?
Hi, Fabiola Gonzalez with First Five Fresno. Just wanting to underline that after this report, I know that you heard earlier the value in making sure that the scopes of work for any of the work that you're doing with lobbyists at the state and federal level connects with the locals First Five commissions. And I can't imagine how helpful it would be for our First Five Association to know from your federal arm in Washington about what's happening, for us to be mindful of what we could do locally with our congressional delegation, so that we are able to provide those stories that you're talking about and that they're mentioning that are critical for our congressional delegation. And this, given that the state First Five Association doesn't have a federal lobbyist, like more reason for us to make sure that there is a direct connection so that we can be helpful in all of that is required for actual effective advocacy at the federal level. So thank you for just considering how to make sure that we lock arms in that federal advocacy with the locals and leverage that resource that you have.
Yeah, thank you. Other public comment from our remote locations? Okay, well, thank you to everybody who shared these reports and for the feedback from our First Five network. We will now move on to item 10, which is our fiscal year 24-25 annual report. This is an action item. I'm going to go ahead and provide an update on the Program and Evaluation Advisory Committee, and then invite First Five's Research and Evaluation team, Dr. Juan Lee and Dr. Rudiel Fabian, to present the fiscal year 24-25 annual report item. During the January 2026 Program and Evaluation Advisory Committee meeting, the First Five California team presented the annual report to us. The committee offered comments on sharpening key takeaways and more clearly highlighting the impact of investments so that the viewer, readers can see explicit connections between what was funded and the results observed. We also discussed the importance of highlighting local funding sources and their impact on overall revenue, recognizing that our collective goal is to increase overall revenue and really thinking about how we can collectively diversify sustainable funding to support the work we care so much about. So with that, I'll turn it over to the team.
Thank you so much, Commissioner. Good afternoon, everyone. I hope you guys had a wonderful lunch. Happy to be here. My name is Julian Fabian, research scientist at First Five California. For the record, I would like to say that this is not a final report yet, so we're here to take your guys' feedback. This presentation will provide an overview of the fiscal year 24-25 of the annual report. We will be highlighting key investments, activities, and outcomes across the First Five network. The report does reflect how First Five California and its local First Five County partners continue to advance equity, strengthen system, and support children 0 to 5 and their families. This is a constant review, pretty much an outline that I will follow throughout the presentation. We will kick off with the North Star and audacious goals, then we'll take it to the result-based accountability, move into the state highlights, county expenditure, result areas, population served data, the county highlights that we collect from all our First Five counties, and then we'll finish it off with our key takeaways. So this slide serves us as a reminder of our North Star and audacious goal, right? The slide grounds our work here at First Five California overarching framework, highlighting our vision, our mission, our North Star, and our audacious goal, and explain why the work we're discussing today matters. The vision, in summary, is that California's children receive the best possible start in life and thrive. The mission describes how we do that by convening, partnering, and help lead the effort throughout the state. Our North Star is especially important for our work. It's with concepts like toxic stress, protective factors, and equity-centered decision-making are central. Our audacious goal sets a bold benchmark. This goal pushes us to think long-term and to focus on prevention, early intervention, and system change. Our theory of change shows how we translate our vision and values into measurable action and accountability. Our theory of change help us identify our levers, which describes the role that First Five California plays to drive systems change. We do play different roles. We advocate, we convene, we also act as a catalyst and broadcaster throughout the state. The result-based accountability image to your right help us ensure that our work is intentional, measurable, and it actually aligns with our North Star. Together, this theory of change shows how First Five California goes from vision to action, using policy, partnerships, funding, and communication to drive trauma-informed equity-centered systems that support healthy development for children 0 to 5. Now moving on into our state highlights. First Light California remains grounded on its core commitment to equity, ensuring that every child, regardless of its background or circumstances, has a strong start in life. In our fiscal report 24-25, we deepen our investments in programs, research, advocacy, and communication that reflects a whole child, a whole family, and a whole community approach. Some of those investments do include $4 million to elevate First Light California Young Child Policy Agenda and to raise the California Strong campaign. We also invested $50 million to our Small Population County Funding Augmentation, known as SPCFA, to help our 21 small counties conduct their businesses. We also contributed $3 million to the First 5 Resilience Initiative. I would like to highlight that since these are brand new investments, there is no outcome data for us to go over today. However, we do have some outcome data for our continued investments. Some of those continued investments includes our CHIS investments, as we mentioned earlier. Our partnership with CHIS actually has strengthened on collecting critical data on children and to explore new topics such as the fatherhood involvement is a topic that we're exploring. So that's a wonderful area for us to explore. We also have our Strong Starts Public Education and Awareness campaign, which continues to deliver its messages around ACEs and toxic stress to all the families across the state. The findings for this specific campaign awareness for the messaging actually help us understand that familiarity with the term toxic stress among families has gone up from 22% in 2022 to 74% in 2024, while the familiarity with ACEs actually went up as well from 20% to 60% in the same time points, same years. The campaign awareness actually rose 92% overall throughout the whole sample size, with 95% awareness gone up among the Spanish-speaking population. That means that we are actually delivering our messages throughout our families, and we are actually making a strong impact across the Spanish-speaking population as well. We also had Impact Legacy, which represents our continued commitment to quality improvements and professional development systems for early learning and care providers. The Impact Legacy actually supported the majority of participation across the majority of settings, in particular the home-based settings, which serve roughly 5,600 children. Centers alone serve just over 4,100 children, with participation split between the impact and the state program funding. Under the other commitment alternative, the settings was a little more limited, serving just fewer than 500 children. However, the learning and care participation was the highest across all settings, with Impact and Legacy funding roughly 7,400 children out of the 10,000 total. Overall, the findings actually highlight the critical role of Impact Legacy funding in expanding access to early learning and care across multiple settings. We also had the SPCFA, which actually supports our 21 small counties. The chart you see on your screen right now shows the total services provided by SPCFA counties over the last 4 fiscal years, broken out by child and adult services. Overall, you can see the services volume increased from the fiscal year 21-22 to 22-23 and peaked at 23-24, reflecting a growth in both child and adult services. In the fiscal year 24-25, you see a decrease from the previous years. And that's because the data from Lake County were not included. But if we had included Lake County data, then it would have looked about the same. We also continue our investments for our home visiting 9 regions completing their final year of funding for regional technical assistance for home visiting, coordination, and integration. A qualitative analysis was actually performed for the last report, suggesting one of the greatest achievements the counties had. One of those were systems access and referral infrastructure, followed by cross-sector collaboration and workforce development. Together, these investments strengthen statewide infrastructure, elevate early childhood priorities, and support local systems to better meet the needs of children 0 to 5 and their families. Can I go back? Oh, there you go. Yes, now diving into the county commission result areas. First, like California and county commissions, we actually track progress across 4 result areas. Those are family resilience, child development, child health, and improved systems of care. In the fiscal year 24-25, county commissions delivered 699,000 with 215 child services, more than the previous year, and 55,297 adult services. When it comes to expenditures across the 3 primary result areas, the total was roughly $298 million, roughly $10 million more than the previous year, reflecting the scale of county level early childhood investments. So I would like to say great job to all our local First Light County for doing more for your own counties. So we congratulate you from First Light California. Now I would like to pass it over to Dr. Lee, who will discuss our result areas into more detail.
Thank you, Bobby. So over the next few slides, I'll walk you through the 4 key result areas one at a time. There are a lot of numbers in these tables, so I'll try to focus on the key highlights. So starting from the improved family resiliency, the table breaks out the number of children and adults served, along with the expenditure amounts. So you can see in the table where the most of the effort is concentrated across the 3 service types, and the total amount is presented at the bottom left. So basically, within this result area, 69% of the spending goes to general family support, which includes programs providing short-term and non-intensive instruction on general parenting topics. And about 25% goes to intensive family support that includes one-on-one clinical services in family support settings. Around 6% support the family literacy and book programs. And altogether, improved family resilience will account for about 26% of the total investment by county commissions in fiscal year 24-25, which is about the same level compared to the last year. For child development area, there are 2 service categories, quality early learning supports and early learning program direct cost. So the total investment in this area, about 88% goes to the quality early learning supports, which are the efforts that are really focused on improving the quality of service, and 12% goes to the early learning program direct cost, which may include the preschool or traditional kindergarten services. So this year, local commissions provided a lot more services in the quality early learning support from about 120,000 services last year to under 72,000 services this year, which is almost 45% increase compared to the last year, which is pretty impressive. For child health result area, this is where we made the largest share of the investment across 4 result areas during the fiscal year. Looking at the service of types, 60% is the child health funding went to prenatal and early childhood home visiting, which is a key service that provide parenting and healthcare education and early learning support for the children and families. And at the same time, we also supported several other essential services like general health education, oral health, early intervention, and prenatal and infant toddler pediatric support. For the systems of care, we made significant improvement to strengthen the broader system that support the children and families. This includes efforts to enhance service quality, building infrastructure, and public outreach and education, all of which help drive the better outcomes for the children that we serve. So strong work across all four results areas is being recognized across California. This is something that we all know, that funding allocation is on statute, that county commission receive about 80% of the tobacco tax revenue and 20% is allocated to First Five California. So you can see the breakdown of the 20% on the pie chart on the right, and this figure is included in the annual report. This slide shows the total revenue breakdown for the county commissions by source. While we all know the tobacco tax revenue declined compared to the last year, counties have been creative in bringing other funding sources through grants, donations, and other local revenue sources. I'd like to mention a major driver this year is the First Five Alameda, which received $6 million from Alameda County Measure C sales tax, which significantly increased the total revenue you see at the bottom of the table. So this graph is describing the pattern I just mentioned. While the bottom line shows the decline in Prop 10 funding over the last 3 fiscal years, the top line shows total revenue is actually increasing, indicating local commissions as a whole are offsetting the decline by securing the funding from other sources, which is really great news. And I also want to note that this reflects a statewide aggregation trend and does not necessarily mirror the revenue trajectory of individual county commissions. A detailed breakdown of the trends in funding sources, other than the tobacco tax revenue, the chart highlights the resilience of these funding streams. The percent label on the upper left of each figure shows the percent change over time. So most notably, 23% increase in donations, 13% in grants, and 235% in interest in earned revenue, and substantial rise in other public funding, mainly driven by the Alameda Measure C sales tax. So moving on to the demographics of the population served, this table shows the language breakdown of the population served. The category reflects some of the most commonly spoken languages in California. And we are also working to better capture the full range of languages by having counties specified languages included in the other category. This helps us more accurately reflect the diversity of communities we serve. And we will continue to work on improving the reporting over time.
I'm wondering, I see Chair Albright's hand up. I'm wondering, Chair Albright, if you wanted to share a question now or if it was for later.
Gosh, if you wouldn't mind, I would share a question now. If you go back to slide 17. You might be getting at this, but maybe just integrate it. Could you talk about what this would look like if you didn't include, for example, First Five Alameda, or I believe Sonoma, San Francisco have also had revenue measures that were supported by their local voters? What would this look like if those measures weren't included?
So I think if we exclude the Alameda Measure C sales tax revenue, which is like $600 million, it would be you will see quite stable total revenue trends over time.
Sorry, this is more my issue because the phone, it's hard to hear.
So he said you would see a stable trend line over time, so that line would be pretty flat.
Yeah.
The blue line would be flat.
Correct, if you took out Alameda, because that represents $600 million.
Okay, thank you so much. I appreciate that clarification.
I'm wondering to that point, if I may, through the chair, and if in the report, if it's not already annotated, it's almost like maybe we should count Alameda separately just to show that, because this could potentially send a mixed message to our policymakers with respect to the ability of locals to leverage additional dollars to support this space, and it's really not that. It's one jurisdiction that is really skewing the total funds line. So I don't know.
Yeah, thanks for your comments. Actually, this table is included in the appendix A of the annual report. And this is just mainly to present the total revenue that includes all local counties, not necessarily individual counties' revenue sources. But since the $600 million is substantial, we made a footnote on this table. Yeah, specifying that the revenue is skewed to the Alameda County this year.
I mean, it's a really interesting story because I think one, it is a different story from other counties, and it should be celebrated. I mean, it's incredible what Alameda is doing, and I know it took a lot of work to do that. I know not all counties, are on that same pathway. So it's both skewing the numbers, and it ought to be celebrated in a way that we can all learn from.
Thank you.
So back to this table, which is showing the population served by the age category. So we have children under age 3 to 5, and those with age unknown, but within age 0 to 5. So in total, we served about 641,000 children 0 to 5, and 511,000 primary caregivers, for roughly about 1.2 million children and families served overall. This table shows the race ethnicity breakdown of the population served. It shows the counts and also the percentage for the children and primary caregivers separately. So you can see in this table, Hispanic Latino is the largest group served, about 31% of the children 0 to 5 and 33% primary caregivers. Another notable change from last year is the substantial increase in the other category, now representing nearly half of those reported, compared to 35% reported in the previous report, which highlights the diversity of population served across the state. So overall, quite an impressive year with a lot of great efforts and great momentum across all areas we discussed. So with that, I will pass it over to Dr. Parvin for the next slide.
Thank you, Dr. Lee. So just to go back to the county highlights, actually, we also performed a qualitative analysis for all the highlights that were submitted by our partners. A thematic analysis, the findings of the thematic analysis actually let us know that fiscal sustainability and funding diversification came on top, followed by system building and coordination as well. So that means that our partners are actually put a lot of emphasis on those two things over the last year, fiscal year. And now to highlight some of the takeaways for our fiscal year 24-25, county commissions deliver almost 700,000 child services and just a little over 500,000 adult services, with roughly 298 million invested across family resilience, child development, and child health. We have also continued our system building amid on declining Prop 10. That's one of the things that was highlighted in the themes from our county highlights. They have actually been working on expanding their revenue source to sustain services. We have also strengthened our statewide evidence base by strengthening our partnership with CHIF, including exploring other research areas such as family development with them. We have also advanced policy conditions that actually support families, protecting progress on childcare expansion, and supporting the transition to enrollment-based child funding beginning in 2026. Overall, I would like to say that First Light California and its partners have done a tremendous work over the last fiscal year. So with that, I'll leave it up to you for any questions. If you have any questions, please feel free to ask.
Thank you, and thank you for the great report. Commissioner Bobby?
Yeah, so in the slide 21, there was, okay, that's a pretty significant, number, and I'm just wondering, did they decline to state or they just checked out the box? Okay. So the question was, does other mean decline to state or is, none of the categories fit?
No, it is both. Decline to specify or the one of the specified categories is not fitting the person.
We separate those two?
Because they're very different.
Yes, we have, we can separate those two.
That's a big group. No other?
And it means two different.
Well, yes, if I can weigh in, I think, and I'll defer to the doctor in the room, but I think we saw a lot of that during COVID as well, where people were identifying their ethnicity and then their race, they were electing to select other. And we're seeing that locally across all of our systems where people will pick their ethnicity. And where in the past they may have marked white as their race, because that's what our birth certificates say, mine, for example. They're now electing to choose other. And so it could also be a combination of, you know, more interracial ethnic marriages, but I think it's more during COVID, a lot of people didn't want to identify or were afraid to identify what their race may be.
Yes, we are continue to work on like including more categories in this section. And more in fiscal year 25-26, we have added the Hispanic distinction, like non-Hispanic, white, and African Americans, and also Tagalog language. Yeah, there are a lot in Tango, and we can definitely separate the other categories into two.
And it's all self-reported, right? So.
Yes.
They have two or more races.
Yeah.
Can I note, this is due to the legislation on the 31st, so if we want to make that change, we need clarity, so we can submit it tomorrow and submit it by 7.
Sure. My request is to separate the other category, which shows 313,000 children, into those that declined to state versus those that indicated another race or ethnicity.
Yes.
Any other specific requests or feedback about changes you'd like to see?
No change, it's just a question.
Please.
I appreciate the overview. My question was around the impact legacy. Because I think that was a pretty big ticket item in the budget as well. Do you mind just describing that a little bit more? It sounds like a training program. And I'm curious if it's a training program, what are we training and are we seeing a difference in the outcomes of that training?
I'm happy to answer that question. Yeah, that's okay. It is our historical investment about what we call the Quality of California system to ensure that the early learning and care community has consistent standards, if you will, to which they are teaching to. So we have the professional development, as they've highlighted, in different sectors. For example, California State Preschool, they have TA, okay, you're gonna have CSB. There are certain state agencies with larger dollars who actually support the professional development of institutional programs. We actually are a gap filler in this, where we actually ensure we understand that different families have care and learning in different settings. But we want to ensure that there's quality across all of these settings, so that's where we come in. And these are the data that you see that really and fill in where there are no other state dollars.
Yeah, so it's great to see that people are getting trained and appreciate that context. I suppose, is it manifesting in a child who's better prepared for kindergarten or in something that we're seeing on the other end of the training?
And so that's an interesting conversation that we've been having for, I want to say, almost a decade with our friends at the Department of Education, Department of Social Services. What does kinder readiness look like? So it's not just our investment, it's that entire ecosystem of what we're looking at. And as things that get a little bit more holistic in our investment, where we're trying to evaluate what does ready for kindergarten mean, or does the system need to be ready for the kids who come in from a developmental.
I'll say, with sort of a mixed delivery system, certain segments of that system are more open to kindergarten readiness assessments than others. And so there is work to shift mindsets around and that what it means for the adults. Right?
And I don't mean to anchor on that particular.
No, that's the question.
Right?
That is
Like,
the
what's the
question.
That is a very fair question, and one that we are trying to get consensus on across our 3 agencies. Again, unique role that First Life California plays, that we get to be in those kind of interagency roles where we hold the conversation across 2 different constitutional officers and possibly priorities. And different labor partners.
And then, yes, please. So on slide 16, there's just all the purple, right? It says other public funds. Is there a breakdown or some kind of asterisk that says what those other public funds and?
I think for counties that reported, we can disaggregate what other public funds consist of.
Great.
Yes, it's in the data, but yeah, just showing the aggregation.
It's when getting that, just as we talk about specific changes. So I'm hearing that's a change we'd like to see in the final report before the end of the month.
Yeah.
Where public funds are.
Yes.
Thank you. And, sorry. Go ahead.
With is 600,000 of that Alameda?
Million.
Sorry, 600 million. Okay. Yeah.
Wait, so say that again, because I don't know if everybody could hear who's joining us remotely. So on slide 16, where it says other public funds of the $725 million, 600 million of that is Alameda. So I would ask in the same way, I think it was Appendix A, you referenced, noted that what was happening in Alameda, if we can see that here, anytime we see one county skewing the data, I think to include that footnote.
Yeah.
On the page 108 of the annual report, it does note the difference of the other funds and pulls out Alameda as an outlier driving up the revenue. So page 108, if folks are looking at the actual report, 108 and 109.
Thank you. That's great.
Can I jump in?
Yes, please.
Vice Chair Chan. Do we want more than a footnote? I'm just curious, like, should it actually be its own line item? People miss footnotes all the time. I mean, this is, again, quite something to celebrate and quite something that's different from what other counties are doing.
Yeah, I think that's a great recommendation. Is there any commissioner who disagrees with that? Okay, so if we can make that change as well.
Yeah.
Thank you.
So just for clarification, because we have a day to work with you. So we want to pull it out in a box. So it's highlighted.
What I'm hearing, and Chair Albright, please clarify, what I'm hearing you say is it would be its own discrete line that is included in getting to this total revenue number. Is that correct?
Yeah, I think that's right. Maybe it's like a sub bullet under other public funds. And so when you add it up, it equals that. But I don't exactly know what the display looks like visually. I just think it needs to be more than a footnote. So if I were to do it, that's what I would do, a sub bullet under other public funds, but there is probably a better way to illustrate it.
Thank you. So making it much more prominent than it is. That's great feedback. Any other questions or requests for changes to the report from anybody not in the room? Well, any commissioners not in the room? Okay. Any final feedback from commissioners? Okay.
I guess I'd like to hear public comment and then maybe reserve to come back if I have any more questions after that.
Yeah, and I will tell you full disclosure, my intention was to do on this one public comment first inform our discussion, and I messed that up. So we will definitely come back if we have additional feedback, but let's go to public comment on this one. Do we have any public comment in the room?
We have one.
All right, hello again.
Hello.
I promise not to stand in the way of our amazing first five colleagues that are here today, the last item, but I did want to make two general comments and two specific ones on the report. First, I really appreciate Director Wong's opening letter in the annual report. I think it really captured the challenges and successes we have in the moment right now, so I do appreciate that message a lot. My other comment was around one of the themes, the top theme that came up from first five counties was fiscal sustainability and funding diversification. Just want to say that again, and that's why it was a little puzzling not to see it as part of the policy agenda. In terms of specific comments, thank you for calling out the $618 million that First Five Alameda received in the fiscal year. I want to provide a minute of context behind that number. First Five Alameda the county passed Measure C in 2000. It was First Five Alameda was the chosen administrator of those dollars, primarily for childcare subsidies. It was held up in courts because it was disputed by some community groups, but the tax was collected and held in escrow or trust over the last 5 years, essentially. And it was finally resolved last year. And so this huge influx of dollars into First Five Alameda is what represents the $618 million. It's roughly around $150 million per year going forward, if that's what you're seeing here. I really implore the commission to think about pulling out that number completely from this chart, because this represents statewide revenue, and it is such an outlier with such specific context that I think it skews it all here. And I would say that it represents 133% of the entire statewide revenue for the First Five network, so it's way outside the bounds. So thank you for recognizing that, and I would recommend just pulling it out completely. And maybe even looking at how county financials could be presented as simply as the First Five California financials are on page 7 of the report. It's a pretty simple graphic, maybe thinking about presenting it that way. The last thing I'll mention is in Appendix C. I think it's mistitled. It says revenues by source, but I know that the charts are about the different categories and not financials.
It's because people who aren't in the room couldn't see the head nod. So there was affirmation that is mislabeled, and it'll be corrected.
Last comment. In the future, given that the bulk of this report is driven by First Five County Commission services, numbers, experiences on the ground, one recommendation I have is to the commission is seeing if the First Five Association can get a preview of the report before it comes here to the commission, so we can add some of this additional context, success stories, challenges, and so forth. So that would be my recommendation. Thank you.
Thank you. Do we have any other public comment in the room? Do we have any virtual?
We have one.
Samantha Bond.
Hello, Commissioners. Samantha Bond, I'm the Executive Director with First Five Lake. I just wanted to echo some of the things that both the commissioners here have said, as well as Alo said around the skewing of the numbers there. Not only does it skew the numbers in terms of the look and implications of the dollar amounts that are being brought in, but also just kind of highlighting and noting that as we look at these, the amount of grants and public funds that we are bringing in, that those are also dollars that are directly tied to the outcome data. So all of the number of children served, number of parents served, number of providers served. And so that also does skew those numbers as to how we can actually effectively serve our populations by that. And so if there's going to be a call out for that, I do think that it needs to be a larger call out for the counties to acknowledge that in a more robust way, that we are actively working on sustainability locally so that we can serve more of our population beyond what the tobacco tax fund can provide us. Additionally, I want to make 2 notes around the actual design of the annual report. One is all of the bar graphs and pie charts in the report are blurry, and so if we can work on that being not blurry, that would be great. And then the second one is on page 9 of the report, there's a big graphic that says California's 59 first 5 commissions, one shared vision. And while we do all share the same vision of working with our 0 to 5 population, the statement underneath of it and the implications of how this report is laid out and how the report is done really draws an eye and a line that states that First 5 California's strategic plan is the same and would be the same as all the county commissions, which is not true. Well, yes, we do all serve the 0 to 5 populations, each of the county commissions. Our strategic plan is very much tied to our county's needs, and we do go through our own vetting process through those strategic plans. And so this feels like a misalignment to the work that local commissions are doing. So thank you.
Thank you so much for that feedback. Do we have any other virtual?
Chair Albright has raised her hand.
Well, I can.
Do we have any more virtual?
Yes, one, First 5 Modoc.
Good afternoon. This is Nicole Hinton with First 5 Modoc. I would like to thank the First 5 California Commission and staff for giving us a review of the annual report. Just in my very quick review of the actual document for the annual report, I did want to note I'm not really seeing anything where it really states that small counties are working extensively to leverage, braid, and really complement funding through public funds with SPCFA. Just kind of want to ditto the comments already said by Avo McDessian, as well as Samantha Bond from Lake. And I do really appreciate it and also look forward to future years where we can elevate where multiple counties across our network, mid, large to small, are pulling out public funds and to find thematic ways of sharing that. Also, I do want to understand better, and maybe I'm not the only executive director, how the thematic themes were pulled out and where that information came from. In the actual annual report portal, there's not a way to specify narratives. So I'm just wondering how that came out and look forward to further information on that. Thank you so much.
Thank you. Do we have anyone else in the virtual queue?
No, we do not.
Okay. And do we have any other public comment from our remote locations? Okay, I'm wondering, Chair Albright, if we, now that we've heard additional feedback from the association about Alameda in particular, if you have any additional insights or would like to see anything differently. Right, the request we heard was to pull it out entirely, or is your preference still to simply include it as a line?
So I have a proposal, but it begs a question, and I don't know who this question is for. It sounds like this money was held, Alameda's money was held in encumbrance pending the lawsuit. Is there a way that this report, this page 16, could just include 24-25 revenue that Alameda would have received, and then a footnote below saying the remainder, whatever was held encumbrance, and explain a little bit more what happened? What I'm trying to do is match apples to apples so that we're looking at what would have been. It's probably a question for a finance person, but that would be a recommendation in terms of presentation. I think that these financial documents are probably these financial pages are probably the most important narrative from my perspective, that so getting it right is, I think, helpful.
Add a little bit color, though we can pull out Alameda, it's also important to know, and the following charts, 17 or 18 slides. It includes ARPA dollars that are one time.
No,
Right.
you'd have to do it. That's why it may not be possible. You'd have to do it for all these financial.
Like there are a lot of one time over COVID, all of that. So go to 18. So this is stark, but also you can see that overall, it's all the funds are going up with the exception of other funds because there are impacts of ARPA dollars, not just for Alameda, just overall. So we're happy to look at it closer, but there's a lot of one-time dollars that have been there for different reasons. We're happy to know the Alameda, but that's also not the only one.
Yeah, no, I understand and don't understand. I understand and I understand the complexity. I was just thinking out loud.
Yeah, I would just echo that I think getting into like pulling out one-time funding will create some knock-on impacts where it's difficult then to sort of like capture because you're really reflecting 5 years of revenue and data in 1 year. But I absolutely hear both the counties and the commissioners pointing out the very valid point that also as it's currently represented, it looks like this huge bump when it's really 5 years in 1 year. I think we can do a lot of work visually to make that clearer.
I think that's great.
I'm a little concerned with like playing with the numbers too much in a way that might cause.
Yeah. Yes, I appreciate that. And I think, my sense is there is consensus about wanting to recognize the context and sort of complexity around what's happening in Alameda and to make sure that any information we're sharing is clear and accurate. And I'm hearing from the team that that is the commitment. And I think maybe as the program and evaluation committee, we can review a final version and fine tune over the next few days. Yes, yes. And then I also heard, and this is hopefully a quick, easy technical one, that the graphs are blurry. So just making sure that everybody can read all of the graphs and all of the numbers that are included, because right now they're not accessible. And then to the point that was made around really highlighting local revenue generation. Chair Albright and I discussed this, and we want to explore this more as we think about future conversations and future reports. So please know that that's definitely something that we want to be able to highlight. And then also heard the feedback around small counties as well. Any final requests from the commission now that we've heard public feedback? Okay, any clarifying questions from staff since we only have 1 day to finish this, or do you all understand? Yeah.
Yeah, I just want to make sure, because I want to communicate all of the actual updates that should be done to the report.
Yes.
So we can somehow, I guess we'll just have to go back and listen to this section again, and highlight all of the actual necessary changes.
Deputy Director Dela Cruz, working with Deputy Director Wilson Morgan, to actually make sure she's been taking copious notes, and a lot of them are visual changes that will take some, just some direction that our PR firm will need to kind of address.
Yep. Thank you. Okay, so I'm sensing that we are aligned and we are clear, and really appreciate all of these final efforts that I know will happen in the next day. This is an action item. So I'm looking for a motion to approve with the requested changes.
Okay, so I make a motion to approve with the requested changes.
Thank you. We have a motion from Commissioner Fabi. Is there a second?
Elsa will second, or Jimenez will second.
Yes, we've got a second from Commissioner Jimenez. And now let's do a roll call vote.
Okay, Shana Hazen.
Aye.
Amy Bernardino Fabi.
Aye.
Elsa Jimenez.
Aye.
Katie Albright.
Aye.
Vivian Paz.
Aye.
And Chris Perry.
Chris Perry is due to scheduling commitments has left the Stanford site, so Chris Perry's not here.
So the motion passes unanimously with Commissioner Perry absent. We'll now move on to our last item, right on time, I will note, and our best. They're all our best items. We don't have different children. But item 11, home visiting coordination grant outcomes. I'd like to provide a quick update from the Program and Evaluation Advisory Committee and invite Janaea Ramirez, First Five California Child Health and Welfare Specialist, and also Kim Gall, Executive Director of First Five Orange County, Sharna Whitby, Executive Director of First Five Riverside County, and Gina Delayden. I know these like breakdowns here. Thank you. Names matter. Executive Director of First Five Yolo County to present on the home visiting coordination grant outcomes. And as they're making their way up, I will share that during the November 2025 Program and Evaluation Advisory Committee, First Five California staff provided updates on various initiatives, including the home visiting coordination grants. Staff went over the successes of the 5-year investment and where First Five California can be supported moving forward. At the request of the committee, the presentation being provided in just a minute has been updated to incorporate real stories directly from the counties to highlight the impact of these grants. In January 2026, the Program and Evaluation Advisory Committee met and discussed the Early Childhood Home Visiting Collaborative's recommendations for strengthening California's early childhood home visiting workforce and systems. Commissioners emphasized, funny to speak of yourself in the third person, but emphasized clarifying the intended outcomes and implementation pathway, and discuss constructive options such as refining framing, acknowledging partners appropriately, engaging leadership to re-energize momentum. We don't want this to be done, but to move forward, and consideration of future support for implementation of the recommendations we will hear. So I will turn it over to the entire team to share with us.
Chair Albright was also there.
Yes, she is. Yes, the commissioners are Chair Albright and myself.
So give me 1 second, share my screen.
Sorry, we are just switching our control of screen sharing from us to Janaya.
Don't be sorry.
So she might need 30 seconds to orient herself.
Okay, are you guys able to see my screen?
We are not.
Not yet. No.
Oh,
If you
no.
can see us, we can also advance from here if that's also easier.
There we go.
Oh, now we've got
There
it.
we go. Okay. Technical difficulties. Hello everyone, and my name is Janaea Ramirez. I'm the Child Health and Welfare Specialist here at First Five California. I'm excited to be here to talk about the successes of the home visiting coordination grants, as well as provide the opportunity for some of our county commissions to share their successes as well. The purpose of this funding was to support local, regional, and statewide coordination towards sustainable, unified local home visiting systems that support families with the services they need. Funding was allocated to provide backbone support for home visiting coordination, help counties integrate early childhood systems to include home visiting, and strengthen regional networks of support. What have we done with the money? The $2 million was approved for a contracted evaluator, and Child Trends conducted a workforce study, which we will talk more about in the next slide. Then, as planned from the October 2019 approval, First Five California issued 2 separate rounds of grants for local commissions. The first focused on implementation and coordination. The second focused on creating regional networks and collaboration. We also funded technical assistance providers and a report on the effects of COVID-19 on home visiting. While this study was not a part of the 24 million investment, we also invested in separate research to complete a workforce study. We contracted with Child Trends, who developed the initial recommendations on this slide in 2022. The purpose of the workforce study was to evaluate existing home visiting workforce to identify current strengths, gaps, and unmet needs in California, to inform recruitment, retention, and higher education and professional development infrastructure and policy. The following recommendations were developed specifically surrounding workforce preparedness, workforce retention, and coordination between home visiting and early childhood systems. We then used those recommendations to inform the development of work groups that CDPH and CDSS had convened in the Early Childhood Home Visiting Collaborative. Within this collaborative, First Five California also helped lead 2 work groups, which focused on workforce and system recommendations, as well as drive this work by bringing in Glenn Price Group to assist in facilitating. Together, the convening developed these recommendations for CDSS and CDPH. These next recommendations I'm going to share are specifically around state level policy, while the ones previously were about workforce. So transitioning back to the 24 million investment, a piece of that was carved out for a technical assistance provider for grant recipients, and also the development of a white paper with policy recommendations to improve home visiting across our state. And that is what you are seeing here. When we get to the counties, you will hear directly about some of the improvements that they've made through this funding and how they align with these recommendations at the county level. There is still some work needed to implement these recommendations at the state level, such as developing state-level communication strategy for home visiting and a central location for sharing publicly funded assessments and evaluations. Now, this is a really fun slide because we get to see counties' greatest achievements. This chart and table below summarize the thematic analysis of the First Five California home visiting investment achievements, which is drawn from county and regional annual performance reports statewide. Each theme represents a major area of progress or innovation identified across multiple jurisdictions, with the frequency of mentions indicating how commonly each theme appeared in local reports. You will see the top achievements are system access and referral infrastructure, cross-sector governance and collaboration, and workforce development and wellness, all of which speak to the purpose and goals of this funding. Consequently, you will see from this chart, the grantees effectively used funds to meet the project goals, showing strong program implementation and capacity. There was a slight drop in spend rate in the second round, suggestive of minor challenges with the regional grant management and subcontracting to participating counties. Overall, there is minimal remaining funds, which shows local commissions capitalizing on this opportunity, which is apparent in not only the spend rates, but the achievements you are about to hear. With that, I'm excited to hand this off to Kim Gall, the Executive Director of First Five Orange County, so she can talk about the progress they've made from this investment.
Thank you, Chair and members of the Commission, for the invitation to be here today, and staff as well, to share a little bit about the successes that we achieved in Orange County. Before I go into the successes, I think it's really important to talk about the context of Orange County. We have about 30,000 births annually. Yeah. Oh, no, sorry. You can hear me, and I was like, no, you're great. Got it. So we have about 30,000 births annually. About 1,000 of those we touch with home visiting throughout the first year. We have, in any given month, we have about 400 open home visiting cases. That doesn't account for all the outreach that goes on before they're actually officially enrolled in home visitation. We, as First Five Orange, have invested in home visitation since our inception. So it's a 25 year investment in home visitation. We are the county's largest investor in home visiting. We outpace CalWorks and the county itself in our home visiting investment. Along with that investment, we have in Orange County an automated closed loop referral system that we do in partnership with all of our high volume birthing hospitals that take a Medi-Cal contract. So the ones that we're missing in that system are Kaiser, that predates their inclusion in Medi-Cal, and then hospitals that do not take Medi-Cal patients. We also are the county's service provider for the CalWorks implementation. And then we have a unique partnership with our child abuse hotline registry. So as calls come in, if there's a verified child in that home, they are then referred into our home visiting network, and we try and encourage that family to come out into home visiting services voluntarily. But we also will provide additional supports for anyone that is not going to receive home visiting. We have 8 home visiting models spread across 8 agencies, the healthcare agency, which we fund, Head Start, and then 6 community-based organizations. We have services in 8 languages, and we have 87 home visitors in working at any one time. Next slide, please. So what we started out to do is kind of coordinate among the silos. So if you were getting CalWorks home visiting, you were working within your CalWorks collaborative. If you were getting First 5 funding, you were working within your First 5 collaborative. So one of the first things we did is we wanted to bring everyone together and allow them to develop a shared mission, vision, membership, governance, all that good stuff. And this is really a commitment to systems change and long-term systems change. And that only really happens once you can convene and share power on systems change. We also thought it was really important to think about a landscape analysis and start to conduct our own landscape analysis in Orange County. What do we know? And again, it's really collapsing all that knowledge into one place. So we're no longer talking about what is the wait list for CalWorks, but rather what's our wait list universally. And then lastly, we really needed to understand and create, even though we have this closed loop referral pathway, how do we create a deeper and more knowledgeable referral pathway? So both honoring family voice and where they want to receive services, but also where are the public funding streams and how can we best use those public funding streams for the highest and best use. And then lastly is really starting to really working with the agencies to get comfortable enough and build enough trust so that we're talking about overall system performance versus individual provider performance, right? Moving from how well are you doing on your contract to how well are we doing as a system to get to model fidelity across all of our programs and achieve those evidence-based results. Next slide, please. So I thought this next slide really helps to illustrate the challenge in Orange County. So the column on your left is the universal assessment or almost universal assessment with the screening of 70% of our births at time of birth. Then you can see the breakdown moving to the right of low risk, moderate risk, and high risk. In Orange County, we don't have a problem of a referral network. We've got great referrals into home visiting, and we can identify our need. What we have is a capacity. What you're looking at the bottom of the 2 rightmost columns is our capacity to serve against the need. So what we really need to start thinking about is how do we triage? How do we provide families the right service in the right amount of time and then hold precious our home visiting slots for those families most at need for home visiting and most likely to uptake on home visiting. So that became our problem, and this landscape analysis, which was done in 2019, and this is actually updated numbers with the recent Strong Start data. So I know you all are big fans of Strong Start data. We use that along with our bedside hospital screens to try and look at what we're collecting versus what Strong Start is telling us as well. So what you see is a merging of those 2 data points. Next slide, please. So what we accomplished, we grew our home visiting collaborative from 2019 to now to over 24 agencies. That's a blend of those agencies that actually provide home visiting services, our triage services, so folks that are not providing home visiting but are providing services to families within that time period, as well as all the funders. So we have the social service agency, the healthcare agency, ourselves. We're all in the room hearing what providers are telling us and co-creating together. We are working towards shared measurements, again, getting to that system level impact. What do we want to say about our system across all of the programs, all of the funding sources? What do we want the public to know when we think about education and advocacy? Again, we have honed our referral pathways, prioritizing all of those funding sources. Always listening to family though, very, very important to put the family at the center of what we do. We currently braid and blend funding, so you can see all of our funding sources there. And then again, what I said earlier, it's really about triage. It's about meeting the families where they are, trying to get them into other services if we don't have an open home visiting service. That includes folks that deny home visiting services. So even though we think they might be a good fit for home visiting, if they don't want to do it, we're using our community health worker partnership with our managed care organization to get them either into classes where that we can offer them concrete supports or social connectivity or anticipatory guidance. We also have a very robust substance use disorder peer support network working right now. So all of this really is helping us be in a great position to continue to leverage additional resources as they come into our county and think about what are we learning, right? What we know is that there's this diversified funding source, and each of that comes with its own eligibility requirements, which only complicate our system. And so holding all of these providers together, allowing them to really have some ownership about how they deliver services is the key to keeping this going. So as First 5 Orange, we're committed to this collaborative and systems change work, and we'll continue it on. So thank you, and I'm going to turn it over to Gina. Thank you.
Good afternoon. Thank you for including me as well. Quite welcome. I'm Gina Delighten. I'm the CEO of First 5 YOLO. We are a smaller, medium-sized county, just a little bit smaller than Orange County and Riverside. As part of your broader story today, I'd like to highlight how the Home Visiting Coordination Grant helped YOLO move to becoming a Medi-Cal provider. So to ground my example, I'm going to begin with a really very brief overview of our largest home visiting effort called Welcome Baby Road to Resilience. Welcome Baby is a maternal and child health equity systems effort, including physical and mental health assessments, lactation consultant, health literacy, and strong connections to community resources. Families receive an early nurse home visit followed by longer-term community health worker engagement. And the effort really fuses medical and social systems. It's coordination that has significantly improved key well child and maternal health, mental health, and safety markers in our county. For YOLO, Welcome Baby has established innovative care coordination across 10 of our local medical systems and braids funding from a variety of primarily public sources, as you see here, including CYBHI, thank you, doctor, and a large multi-year grant from a CDSS, Office of Child Abuse Prevention, and a healthy dose of our Prop $10 that we have remaining. This multi-system braided infrastructure has positioned YOLO to move more decisively as Medi-Cal opportunities emerged. Next slide. Yeah. From this base, YOLO worked through Partnership Health Super Region, I think as First 5 California called it, of 21 counties to build Medi-Cal funding stability for home visiting in alignment with First 5 California's funding goal. So with critical effective support from the First 5 Policy Center, the region regularly connected directly with DHCS and our managed care plans to establish First 5s as a network for service coordination. And it enabled many of us to draw Medi-Cal dollars. The work inspired and accelerated the plan's IPP grants to county First 5s, and more than 17 First 5s engage with managed care plans to either connect or contract over CHW and CalAIM benefits to offset eligible costs in home visiting programs. For YOLO, the regional work that we participated in reinforced and supported our ability to set the stage for successful Medi-Cal delivery and funding realignment. Next slide. So the First 5 YOLO example reflects a deliberate agency and capacity iteration, aligning our early childhood infrastructure with Medi-Cal while protecting access to effective home visiting and maintaining family trust. Over the past year plus, we completed a significant transformation to operate within the Medi-Cal delivery and billing framework. We contracted with managed care plans as a supervising provider for both CHW and ECM, positioning First Five as a trusted delivery partner within the healthcare system. We intentionally invested in infrastructure, leveraging to hire a Medi-Cal projects coordinator and training program staff to operate within CHW and ECM requirements. We also executed legal agreements with our 10 medical systems and hospitals to support grounding and labor and delivery, shared care coordination, and all of the reporting that First Five would need for Medi-Cal billing. The work embeds early childhood prevention and home visiting directly in clinical care systems. Notably, this transformation did not come at the expense of family access and family voice. We maintained and strengthened Welcome Baby as a single coordinated entry point for home visiting, preserved a no wrong door approach across our systems, and intentionally expanded parent voice, including fathers, dual language learners, and our rural families. Next slide. So, our home visiting coordination experience supported agency and systems transformation and translated into funding stability, accountability, and stronger state partnerships. Our transition to a covered entity opened access to Medi-Cal funding, of course, particularly as Prop 10 continues to decline and our grants ultimately sunset. We're now actively billing CHW and DCM to offset home visiting costs, bringing public dollars to build home visiting systems with more durable funding. At the same time, our collaboration with DHCS and managed care plans has matured. Through applied on-the-ground implementation, we feel like we're helping inform how CHW and CalAIM can best serve our young children and families, including it earlier this morning in a meeting with DHCS. This work has strengthened partnerships and accountability across the work. Working with the Super Region, our largest managed care plan, Partnership Health, established an in-house liaison to streamline coordination and problem solve, and it is highly effective, and we're really grateful for that piece. We've implemented formal data exchange protocols with both our local managed care plans to support evaluation and quality improvement, and we've expanded outcome and fiscal accountability with DHCS and our managed care plans. These partnerships have positioned First Five YOLO not only as a funding recipient, but as a home visiting systems partner at the state level for Medi-Cal delivery. So for a smaller, I think I may have skipped a slide entirely, but I've read through it. For a smaller medium First Five, this transformational change really has required very intentional focus and a hefty dose of change management. It's worth it for the opening access to funding for home visiting services that we know work and that children and families need. So thank you, First Five Commission, for your partnership in crossing this new frontier. From the position of a smaller First Five, it wasn't very easy. And so having multiple partnerships has really helped. I mean, when we talk about braiding and leveraging, we're doing a lot of juggling with that. And thank you for any coordination that you help inspire and coordination that you've driven from your own seats. Thank you. And I will introduce Sharna Wheatley from HCSI.
Thank you for having us today. I am so excited about this. It's my favorite thing to talk about. I am Sharna Whitby. I'm the Executive Director of First Five Riverside County. So a quick overview of Riverside. We have around 28,000 births a year. Last year, we served 560 unduplicated families in our CalWorks home visiting system. Our referral to enrollment timeline's around 11 days now, which is a big deal because it was closer to 60 to 90 days before we started doing this coordination work. And so for our fiscal kind of reality, we have a $3.4 million allocation in CalWorks home visiting. And we have a total budget of our investment, including Prop 10 and other sources, of 5.2. Operationally, we're coordinated across county public health and health system providers, school district-based models, several CBOs, and a private OB clinic provider. And we've coordinated intake and referral pathways now with form handoffs. All of our Health and Human Services county departments have a universal intake and whole person assessment system. So we've embedded into that process as well. Next slide. So our problem really was all of our different programs were incredibly underutilized and under-enrolled with no systems backbone to it. And building that out is what I think fixed our problems. This slide is basically proof that the systems coordination works. This is a real-time shared dashboard between us, DPSS Children's Services, and Self-Sufficiency, and our public health, our Riverside University Health Systems Public Health Department. And so we can drill down to referrals, enrollment, and capacity by provider, and also families by zip code, so that when we do the referral intake by any county department, it is automated to where there is capacity. So that is part of our integrated data system that we were able to build. So the blue line is Prop 10, and the red line is CalWORKS. In 2023, you can see a sharp decline in Prop 10, as our commission said, we shouldn't be funding direct service if there's a state funding stream that's sustainable, and we should use Prop 10 to wrap around CalWORKS and fully utilize it. So you can see that was a big shift. We had one referral source for CalWORKS and visiting that was allowable. It was like a straggly, pitiful thing. But you can see, there's two sharp red lines or two sharp clips. Those are both February 24 and February 25 that were spikes driven by rapid improvement events that were funded by this coordination grant between us, Department of Public Social Services, their two divisions, and public health, where we got our teams in a room to fix the specific bottlenecks, and we were able to sustain capacity. Next slide. So speaking of the rapid improvement events with the other two departments, we really focused on provider assignment, intake to eligibility, so the end-to-end process, and not just tightening that up, but automating it. The blue line is really the referral source that we had before we did this coordination work. And since then, we've been able to increase intake across systems and add additional funding. So we have a lot more families coming into the system. And so now the whole system's really built around CalWORKS as like the backbone, and Prop 10 fills the gaps around it. So families that fall out of eligibility, families who want to stay in past the 24 months, or whatever that might be. And then we layer other funding streams on top of that. So now, as a result of this work, we're building wellness coaches in CYBHI. We're using FFPSA, and we also have a community health worker hub that we are building with as well. Next slide. So what changed? Our enrollment more than doubled. It's almost 3 times what it was, and it will have another 300 families potentially next year with the FFPSA investment to wrap around it. We saw families who were previously opting out and losing the opportunity to come back in, being offered FRC resources now and coming back in through a second invitation, and that has almost a 70% acceptance rate compared to the less than 10% for the first offers. And we've really reduced all of our administrative churn. So families are getting more stable services, and all of our providers just have one contract, and we do the hard work of writing the funding so they can just serve the families. If we send it their way, they can serve it. And so what's next for us that we really need to figure out is continuing to work with the FFPSA spend down. We're standing up our Title IV billing mechanism so that we can provide a match and draw down the 50% match, and then finalizing our graded funding map, because I know there's funding we haven't accessed that we should be layering in. So we are continuing along that path. Next slide. So collectively, between all of us, we were thinking about how this really represented this funding is something we can't do with our program funding, right? It really represented a shift in how we operate as programs, as systems, and have to do that to get where we are. So those TA dollars were really systems building capital, and it shows in sustainable infrastructure. They paid for standard work, infrastructure, cross-agency accountability, all of that really unsexy stuff that means families are getting served and served well. Collectively, we've improved our readiness for Title IV-E prevention claiming and future billing mechanisms, and this really is the positioning work for how we will become eligible for bigger, more sustainable funding, not just operating our program for another year. And we've made supply and demand visible, which is a huge capacity building process for all of us. So our triage can be smarter and we can fund smarter along with that. So we're not just funding spaces and programs. We've reduced the competition and wait lists by coordinating referrals across providers and funding sources. And we've improved the funding predictability by layering in funding rather than separating out programs. So next slide. So what's next for this work? I think we really wanted to call out that we have a lot more opportunities than we did when we started this work. It opened up a lot of doors for us. And regionally and locally, we were able to build that interagency governance and infrastructure. There's a super region. Kim and I have been working regionally in our home visiting systems building. And so there's a lot more to build on at the state level as you think about state level interagency data sharing and governance. To really build on those implementation realities and continue the administrative advocacy to maximize funded grading. First Five California has been a really great partner with us as we've been developing draft guidance for CDSS on the FFPSA CalWORKs separation and how First Fives are uniquely positioned to help draw down both in a smart way and to continue to think about those opportunities together. And back to Janaea.
Thank you.
Thank you, Sharna. And now that we know about their successes and what's next for the counties, how does First Five California help? First Five California can continue federal and state advocacy, assist in coordination between state departments with a focus on programs that local commissions are involved in, continue to participate in information sharing of state-level home visiting efforts, and support local commissions by being the convener. Thank you. And before we open up for questions, I just want to thank Kim, Gina, and Sharna for taking the time to travel and be here today to share about their county successes. Thank you so much.
I would say thank you for leading the work. It's pretty incredible. So I know we are at time, but I want to offer time for commissioners to share any feedback or questions. Yes, please.
Thank you for your work and the efforts. Certainly agree that effective administration makes everything else possible. I'm curious, as First Five entities have so many partners that directly employ some of the providers there, am I correct in understanding you're essentially building in some examples centralized billing hubs that then maybe take an administrative fee from various providers in order to see the long-term sustainability of that?
For us, absolutely. We think of our position that's really coming up just so that everyone can hear.
Thank you.
Sorry, that's all right. Can't change my OCD. We absolutely embrace that role for a couple of different reasons, like just thinking of CalWORKs home visitation, and just tremendous amount of risk and complexity in entering into a contract with a government agency. So if you're a small nonprofit, that could be a barrier right away. You don't know if it's time for a pay down, with fiscal reporting, all of that kind of stuff. So we absolutely see our best and highest use and service in this is to be that administrative hub, and that would be the same thing for any of the Medi-Cal billing and our need help workers. So where we can make it easier for our nonprofit, we will. The other thing that I think is really, really important is we in government love to do an RFP. RFPs are incredibly destabilizing for our nonprofit community. So one of the things that First Five does for the ShareNet is it's one contract. You're going to contract with First Five. Whether I get that money from CalWORKs or I get that money from our own bank or somewhere else, it doesn't matter to you. You are contracted to serve a population or a niche. You have your expertise, and we want you to focus on it. And we will hold you accountable for the dollars that we give you. We're not giving you a free ride. That's not what it's about. But it is about standing between something that can be incredibly risky and fluctuating, and their quality service. We want them focused on quality service.
Any other questions in the room from commissioners? Any questions from commissioners not in the room? Or comments? Okay, do we have any public comment?
Virtually, no.
None in the room. Do we have any public comment from any of our other locations?
None in Washington.
I'll go. I just wanted to say before we wrap up, we heard from Yolo, this is really hard. And for me, and it's maybe seem trite, but it is a reminder that we can do hard things, right? And when we do, and we stick to it and we fund it and we do it year after year, transformation occurs. And I think the stories you've told, when we look at enrollment numbers, those aren't just data points. Those are real lives that have been changed because of the work you're doing. That hard, unsexy, behind the scenes, keeping RFPs away from people who don't want them work, that really changes lives. So I just want to thank you for doing the system building work and partnering with us in all of that.
And I wanted to thank Janaea. Janaea was actually hired when we shifted from direct funding to a systems model. So a lot of this is her build and working with a lot of the counties, and we've talked, look at Gina, we've had this conversation, and the counties taking a risk on systems building and the commission being clear that we are systems oriented with declining revenue. This is what we need to be doing and thinking about. And so I just want to be super clear that it was new to us in terms of how we fund things per the direction of, so thank you all for the vision. It's aligned with our strat plan. And thank you for Janaea for actually fulfilling that, that vision, if you will.
Awesome. Thank you to everyone. And now I'm just looking for a motion to adjourn.
A motion to adjourn.
Thank you. Okay, we have a motion. We don't need a vote. Our next meeting is scheduled for April 16th. As I shared, our intention is to talk about durable, sustainable, diverse funding sources, lift up some of the stories of what's working. And continue the work with all of you. So thank you, everyone, and see you in April. We are adjourned.
Thank you.
Thank you, everyone. Take care.
Thank you.